Imagine this: the year is 20. You are sitting on your porch, reading paper, and this is what the headlines look like. 10 million dead as a consequence of antimicrobial resistance. All to drug-resistant infections. The only thing that is not happening as per the envisioned script is that, well, we will not have newspapers in 20s probably. The other two are neither false claims nor are they exaggerations. They are prophecies waiting to come true. Ladies and gentlemen, a very good afternoon to you all. I am Rit Shrestha, Scientific Coordinator of Science Against AMR, SWC, and second year medical student at our medical. I welcome you to the very first AMR MUN organized as a collaborative effort of IVSA, Nepal, and Alliance Against Antimicrobial Resistance. We have among us Ms. Prashamsha Ghimire and Ms. Priya Lamichhane, who have guided us through the process of MUN over the past week and now grace our panel as chair and co-chair respectively. I would also like to welcome Mr. Noyan Nupani, Senior Executive Officer of Alliance Against AMR and one of the founding members of our chapter. Ms. Ashish Adhikari, the President of IVSA Nepal, as well as Ms. Sharma, the President of IVSA Paklihawa and the Director of our event. We also have Ms. Snehalata Karna, Program Director of AAA FUC, with Ms. Bhima and Committee of IVSA, Ms. Rit Shrestha, Membership Manager for Alliance Against AMR, Ms. Secretary of Alliance Against AMR, Ms. Shantima, Ms. Prati Gurung, and Ms. Samiksha Burathuki, the Technical Coordinators. The rounds of virtual applause. Alliance Against AMR and IVSA Nepal are both strong, active warriors against AMR, working actively to fight against one of the biggest global threats that we'll be facing in a few decades. As the magnitude of the problem grows, the need for solidarity has become even more pronounced over the years. This year, on the occasion of Antimicrobial Awareness Week, we have joined hands with one another and we are organizing several events that we hope will induce a positive change on a local scale as well as in global healthcare. AMR Model United Nations is our collective effort to encourage young individuals and against antimicrobial misuse by learning more about the issue. So we are really grateful to delegates for your enthusiasm and your will to learn, grow, and all in all, incite change. Now, I would like to request Mr. Noyan Nupani, Senior Executive Officer of Alliance Against AMR, to enlighten us on the principles and organizational goals of Alliance Against AMR. Noyan, the platform is yours.
Thank you very much, Rit. Namaste. I'm Noyan Nupani, and my greetings to everyone present here. So I work as a Senior Executive Officer of Alliance Against AMR. So talking about our organization, we are basically a group of medical professionals and students working as a team, and we have been working since 2018. I also want to take this moment to appreciate that we are a first group working in field of antimicrobial resistance. So what we basically do is we work on first strategic objective of global action plan on antimicrobial resistance, that is to improve awareness and understanding of antimicrobial resistance. For this, we perform various academic activities that are focused towards the educated group or our group members, and community focused non-academic activities as well, including street dramas and so on. So we have been celebrating Antimicrobial Awareness Week since our establishment, and this year, as the theme of this Antimicrobial Awareness Week goes, working together to preserve antibiotic, we take our great pleasure to collaborate with IVSA Paklihawa, who has been working in the similar field. And today, as the product of this collaboration, we are having our first Model United Nation on AMR. I suppose this is our first time in Nepal when antimicrobial resistance is taken as an agenda and discussed in Model United Nations. What I hope is this Model United Nation will bring about deeper understanding and awareness on antimicrobial resistance, so that we can halt next potential pandemic from affecting our life. I would like to take this moment to extend my gratitude to Chair Ms. Prashamsha Ghimire, Co-Chair Priya Lamichhane, Director Ms. Suvha Shree Sharma, Moderator Ms. Rit Shrestha, and all our wonderful delegates. I wish for the success of this session and other sessions to follow. Lastly, I also request everyone to join this fight on antimicrobial resistance, as I believe we people working in the field of health, be it human health or animal health, are the ambassadors of our community and can bring about changes. With this, I would like to conclude. Thank you very much. Have a wonderful session. Thank you, everyone.
Thank you so much, Dada. I would now like to invite Mr. Ashish Adhikar, the president of IVSA, to address the audience and share his insights on the objectives of IVSA. Over to you, Ashish ji.
Am I audible?
Yes, you are.
So, thank you, moderator. It's me. For personally, I'll introduce myself. It's me, Ashish Adhikar, the president of IVSA Nepal. First of all, I want to congratulate Alliance Against AMR and our local chapter, IVSA Paklihawa, for this organization of Model United Nations MUN on the occasion of Antimicrobial Awareness Week 2020, which is being celebrated from November 18 to November 24 annually. So talking about International Veterinary Student Association among all the participants, it is a group of veterinary students. We are dedicated in human and animal welfare collaterally, and we are here. We are established in 2016. In the past, there was a local chapter called IVSA Nepal, in IVSA Rampur is a chapter in Nepal. Sorry. So in 2016, we extended our chapters in all 4 veterinary colleges with the aim to extend it to all 4 veterinary colleges. IVSA Nepal was established and it has been working, and there are 4 local chapters under IVSA Nepal. They are IVSA Paklihawa, the host of this month, and then there is IVSA Rampur, IVSA Hikast, and IVSA NBI. There are 4 veterinary colleges in Nepal. So talking about this program, I want to congratulate Alliance Against AMR and IVSA Paklihawa for this coordination. Hope this coordination will be fruitful in future also, and will go in upcoming days also. And I want to give a big thank for our co-chair and chair of this MUN, for being accessible and coordinating this program from start of. I have been looking at all the activities of this MUN, the training and the sessions. I think it's been like 10 days since the activities of MUN started. So they have been doing great job, and I want to thank on the behalf of IVSA Nepal. And we saw, as a veterinary students, we must be very responsible in the use of antimicrobials. For me, it's like a climate change. Actually, everyone knows about the climate change, but those who know about climate change, they don't know all about antimicrobial resistance. It's a huge problem in this current scenario in this world. So the MUN on this antimicrobial resistance can increase our skills, and it flourishes our research skills in the antimicrobial resistance. Everyone will know, everyone will learn, and it influences our public speaking, problem solving skills on the antimicrobial resistance, and so on. So MUN is a great platform for debate for to increase our debating skills, and specifically in antimicrobial resistance. It's a very new concept. I think there are very few MUN conducted on this topic. So it's a great um, pleasure to be part of IVSA movement. The organizer of IVSA Paklihawa, it's doing great job. And then I want to thank all the DIs, and hopefully this program will run successful in the coming days. There are other sessions also. Apart from this MUN, there are conference also. This coordination will go good in further upcoming days also. So thank you, and thank you, all the best of luck for all the participants over here. um, and thank you. That's all from me.
Thank you so much, Ashishi. One of the esteemed core members of Alliance Against AMR has joined us. Please welcome Mr. Active Adhikari. Now, moving on, I'd like to request our trainer and the chair of AMR MUN, Ms. Prashamsha Ghimire, to kindly share her thoughts.
Thank you, Rit Shrestha, for that introduction. I'm Prashamsha Ghimire, and I'm currently a third semester law student at National Law College, Sanepa. And I was introduced to this MUN by our very organizers. Um, am I audible?
Yes, you are.
Okay, so I was introduced to this MUN by our organizers, which I'm very thankful towards. And we've had a very active audience and a very active participants from the colleges and organization as a whole. I look forward to a very productive session today. And after 3 workshops that we together worked on, I believe everyone is now familiar with the rules of procedure and how to research on the agenda and many other stuffs related to the MUN. And I'd like to thank the organizers once again, and my co-chair, Ms. Priya Lamichhane. We've worked together in this, which I'm grateful for again. So thank you. Over to you, moderator, ma'am.
Thank you so much, Prashamsha ji. May I now please invite Ms. Priya Lamithani, the co-chair of AMR MUN and our trainer, to share her wisdom.
Firstly, good afternoon, everyone. It's my privilege to be a part of this MUN, as this is the first ever happening MUN that relates with antimicrobial resistance in our country. It's my privilege to be a part of this program. So, thank you for having a very collaborative organizing committee and enthusiastic delegates. So, in response to the pre-conference session that has been conducted till the date, it seems like this session would be a huge success, and it will not be possible without the collaboration of all the present participants. So all the best to the team, all the best to everyone, and let's open a very productive session in our coming 3 days. Stay safe. Let this session be the one of the most productive events of your life and a fruitful experience to remember throughout. Thank you very much. Over to you, moderator.
Thank you, Priyaji, and thank you to all our speakers and also our delegates. Now, moving forward, I'd like to hand over the microphone to the chair, who will now lead the program. Over to you, ma'am. delegates. Now we will be starting with the committee session. Be prepared.
Okay, so we'll be starting in around exactly 2:30 p.m. in 3 minutes, so that everyone has few minutes to prepare their GSL and just get organized with their competition forward. So see you at 2:30 sharp.
Hello to all the delegates. Please rename yourself to the respective country you are representing before we start the session.
Okay, so everyone. Okay, so everyone will be now starting with our formal sessions. Before we move into our formal sessions, please rename yourselves as the country that you've been assigned, or if you are the organizing member, please rename yourself as the OC. So we've got Shanti Lama ma'am. Could you rename yourself? Prakriti Guru ma'am, if you could rename yourself. Nayan Neupani sir. And then we have Bhagiras Puri. If you're the organizing committee, it would be great if you rename yourself as the OC. Miss Anupama Yadav and Active Adhikari. So these are the names that I just called out who have not been yet renamed. If you could rename yourself. So without further ado, I think we should start with now with the committee session. But before that, does anyone have any confusions regarding the rules of procedure or the position paper? Has everybody submitted the position paper or not? If you've not submitted it so far, I'd request you to email it to the organizer so that they can forward it back to us. Other than that, if anyone has any question, you can raise your hand and I can address it right here before we move forward with the committee session. So you can raise your hand or you can type it in the chat box and then I can address your question regarding the rules of procedure. So we move forwards firstly with the roll call, followed by setting the agenda, followed by the general speakers list, followed by moderated caucus, followed by unmoderated caucus, and you'll have to draft the working paper and the draft resolution as well. Simultaneously, we'll be learning that in the committee sessions itself. So besides that, you have the point of information which you raise during the general speakers list speech. You have the point of order which you raise if the dais members make any mistakes. You have the point of parliamentary inquiry if you have any confusion regarding the procedures. You have the point of personal privilege if you want to be excused from the committee. And finally, you have the right to reply if any country hampers the sovereignty of your country, you have the right to exercise your right to reply. So other than that, if there are any confusions with the rules of procedure, you can right away text me personally in the Zoom chat box or raise your hand. I'll be recognizing you. So without further ado, let's begin with the roll call. I'll just be going in the order that's been mentioned in my screen. If I miss anybody's roll call, please do text in the group, okay? So Nigeria,
Present and voting.
Nepal, delegate of Nepal,
Present and voting. Present and voting.
delegate of Sweden,
Present and voting.
delegate of Thailand,
Present.
delegate of Thailand, delegate of Thailand.
Hello.
Yes.
Can vote.
What is your stance of voting? Delegate of Thailand, are you familiar with the rules of procedure? You're supposed to reply as present or present and voting. So what is your stance on the voting?
Am I audible or not?
Yes, you are.
Present and voting.
Thank you, delegate of Thailand. Next up, we have delegate of United States of America.
Present and voting.
We have the delegate of Albania,
Present and voting.
delegate of Indonesia,
Present voting.
delegate of Korea,
Present and voting.
delegate of South Africa,
Present and voting.
delegate of Russian Federation,
Present and voting.
delegate of Australia,
Present and voting.
delegate of Fiji,
Present and voting.
delegate of France,
Present and voting.
delegate of Philippines,
Present and voting.
delegate of Vietnam,
Present and voting.
and delegate of United Kingdom.
Present and voting.
So did I miss anyone's roll call? Vice Chair, can I know what is the simple majority? And did I miss anyone's roll call? Or if the moderator can tell me what's the simple majority of the committee, that is the total number of delegates divided by 2 plus 1, 50% plus 1. So I see a new delegate, that's the delegate of Japan. What is your stance on the voting? Delegate of Japan, are you there? What is your stance on the voting? Moderator, are you there?
Yes, there's been a technical difficulty. I'll look into it and tell you.
Okay. Director ma'am, what is the simple majority of the committee?
Majority of the delegates have voted for present and voting, and Thailand has voted for present, I guess.
Yes. So that's so what is the total number of delegates that's present in the committee right now? If you can count the number of delegates who are right now in the meeting and tell me so that I can. Okay, so am I audible right now to everyone?
We have 17 delegates, Chair.
Sorry?
We have 17 delegates present here.
18 actually. One delegate has just joined.
Yeah, I guess
So
Chairman has just joined.
So I've seen few delegates joining from two different devices. That would create confusion, like delegate of Nigeria. We would like to request you to delegate to join from the one device that it will be easy in order to make the voting stances clear.
Okay, so all in all, we have 17 delegates, right? Okay, so
Yes,
delegate of
sure.
Japan, am I audible to you? What is your stance of the voting? Delegate of Japan, are you there with us? If you are, you can unmute yourself and then give your stance of the voting. Can anyone check on delegate of Japan? The delegate is present in the committee, but they're not replying. So anyhow,
So here I will be texting him personally, so you may proceed towards the session.
Okay, thank you so much. So all in all, we have 17 delegates divided by 2. It's 8 to the 16. So the simple majority of this committee is 9 votes. So for any motion to pass henceforth, you would need 9 votes. Okay, so delegates, are there any points or motions on the floor? You may raise your hand.
Excuse me, Chair. Thailand is present and voting, right?
Yes,
There
sure.
was
Yes, sure. So the delegate of Thailand has already responded. I meant the delegate of Japan, their stance, but never in mind. The co-chair will check on him. So delegates, are there any points or motions on the floor? Please raise your hands. Yes, delegate of Nigeria.
Delegate of Federal Republic of Nigeria would like to set a motion on the agenda in the topic tackling AMR, securing the future from Superbugs.
Thank you, delegate of Nigeria. That motion is now in order and passed by the discretion of the dais. Hence, the agenda for the WHO committee has been set to tackling antimicrobial resistance, keeping the future safe from superbugs. Okay, so delegates, are there any points or motions on the floor? Yes, delegate of United Kingdom.
The delegate of United Kingdom would like to start the motion to open the floor for general speakers list with 90-second time for individual speakers.
Thank you, delegate of United Kingdom. Are there any other points or motions on the floor? Yes, Republic of France.
The delegate of France would like to set a motion on the topic area antimicrobial resistance as a global concern and how could we act locally and think globally.
Okay, so with looking at the importance of the motion raised by the delegate of United Kingdom will be set to voting because after setting the agenda, we first go to the general speakers list and then only we can go with the moderated caucus, and hence the motion set by delegate of United Kingdom passes with general speakers list floor opening with each speaker getting 90 seconds. So Delegate of United Kingdom, would you like to be the first speaker or the last speaker?
I would like to be the last speaker.
Thank you, Delegate of United Kingdom. So the delegates wishing to speak in this particular general speakers list may raise your hands or type your name in the chat box. The DAS members will enlist your name in the screen. We have Republic of Korea as the first speaker, followed by South Africa, followed by Sweden, followed by Australia, followed by Nepal, followed by Philippines, followed by Vietnam, followed by Thailand, okay, so if your name has already been enlisted in the screen, you may lower your hands. Delegate of Sweden, would you wish to speak again? Or, okay, your hand is lowered now. So are there any more speakers who would want to enlist your name in the general speakers list? You may raise your hands. Um, okay, so Russian Federation, followed by Russian Federation, and as our followed by Nigeria, okay, so we'll have our last speaker as Delegate of United Kingdom. Okay, so Delegate of Republic of Korea, you may go ahead. You have 90 seconds on the floor. Good luck.
Hello everyone. Antimicrobial resistance is a major threat to human and human development, affecting our ability to treat a range of infections. The delegate of Republic of Korea wants to inform that every year more than 15,000 cases of gonorrhea gets reported in South Korea, and as per the surveillance, they are monitored under antimicrobial resistance, which clearly indicates the risk of increasing antimicrobial resistance in South Korea. Though being the developed country, Korea is suffering from a huge amount of antimicrobials consumption in a very haphazard way. Hence, South Korea is currently experiencing many problems and challenges from antimicrobial resistance. Thank you.
Thank you, Delegate of Korea. You still have 51 seconds remaining. How would you like to use your time?
I would like to use this time for myself to ask the question at the last.
Okay, so you want, okay, yes. So are there any points of information for the Delegate of Korea? You may raise your hands and ask the delegate the question. So if you have any questions or point of information for the Delegate of Korea, you may raise your hand. If not, then the DAS members will ask you a question. Okay, so Delegate of Korea, what are the specific plans your country has implemented to combat this AMR that you're talking about? Delegate of Korea?
Okay. Yes, please. Okay, yeah. Recently, the Republic of Korea has formed an interagency coordination group on antimicrobial resistance. It has made a future global governance for antimicrobial resistance and currently working on that approach. The government of Korea has also set some budgets on it, and they are specifically working to reduce the antimicrobial resistance for now. The Republic of Korea is also collaborating with the UN and is trying to reduce the antimicrobial resistance by following the global plans which are suggested by WHO. That's all.
Thank you, Delegate of Korea. Nicely answered. Next up, we have Delegate of South Africa for
So,
90 seconds. Okay.
Chair,
Yes.
am I audible? May I have
Yes,
a
ma'am,
question
you
for
are.
South? May I have a question for Korea?
Yes, ma'am.
So, Korea, are you open for questions?
Yeah, please.
So, as you have mentioned gonorrhea on your speech, right?
Yeah.
So, as per the report of CDC that has been published in 2019, there has been several victimized of gonorrhea as a general disease in your country. So, in response to specific gonorrhea treatment patient, what has the country done in order to protect their health insurance in upcoming days?
Okay, fine. The government of South Korea has recently allocated the budget on antimicrobial resistance, as I mentioned before. Now, for the treatment of gonorrhea, the patient of gonorrhea used to visit the primary clinics. There are certain primary clinics in South Korea, and they used to visit the primary clinics before. But for now, they are under a special surveillance and which are monitored by following the guidelines of antimicrobial resistance. Thank you.
Thank you, Delegate
Thank you
of
very
Korea.
much.
Nicely answered. Next up, we have Delegate of South Africa for 90 seconds.
To quote the former director of CDC, Tom Frieden, if we use the antibiotics when not needed, we may not have them when they are the most needed. With prior permission of the chair and delegates of the House, the delegate of South Africa would like to commence with the agenda. The deployment of antibiotics over the course of 20th century has rendered many previously dangerous diseases easily treatable, but today more and more of these antibiotics are becoming less effective. The burden of communicable diseases, and especially the HIV and AIDS burden in South Africa, points to a scenario of extensive antimicrobial use and subsequent resistance. Its journey on AMR started in 2011 with the publication of situation analysis highlighting that it has a quadruple burden of resistant infectious diseases. South Africa pledged its commitment to the World Health Assembly resolution in May 2014 to develop a national action plan on AMR. In 2014 October, the Minister of Health launched the National AMR Strategy Framework and outlined the country's plan over the span of 10 years for the management of AMR and improvement of patient outcomes. Since then, it has been working actively in its animal health and environmental colleagues to update the AMR strategy framework. Therefore, deeply concerning the issue of antimicrobial resistance, the delegate of South Africa strongly believes that all the countries should realize the magnitude of the problem and actively join this battle against the superbugs. Fighting this threat is a public health priority that requires a collaborative global approach across all sectors. Thank you.
Thank you, Delegate of South Africa. You have still 20 seconds remaining, right? She still had 20 seconds remaining in the speech. So how would you like to yield your time?
I would like to yield my time by any questions.
Okay, so are there any questions for the delegate of South Africa by the delegates? If you have any point of information for the delegate of South Africa, you may raise your hands. If not, then the DICE member, I have a question for you. So there have been two pandemics in Africa, that's HIV AIDS and tuberculosis in the past years, and now added COVID-19 as well. So it makes it harder for the government to combat as new diseases are emerging in South Africa. So what is your response plan to this?
Yes, South Africa is trying as much as possible by implementing like lots of plans, but even like rural areas of South Africa are not people are not still aware about the antibiotics and its use, and also yeah, it has been really hard for health in health status in South Africa. Uh, that's it.
Thank you, Delegate of South Africa. Next up, we have, if the co-chair has any questions for Delegate of South Africa.
No, Chair, you may proceed ahead.
Okay, thank you. Next up, we have delegate of Sweden for 90 seconds.
Thank you so much, Honorable Chair, fellow delegates, and the esteemed guest. In 1920, when penicillin was discovered for the first time, it was considered as a miracle drug. In Fleming's Nobel acceptance speech, he ended with a warning on how antimicrobial resistance could be one of the world's most serious public health problems. The Kingdom of Sweden, being a victim of it, believes that if there's no action today, there's no cure tomorrow. That's why it has been working on an effective infection prevention, control programs, cross-sectoral One Health perspective, and international cooperation. In 1986, it was the first country in the world to ban the use of antibiotics as the growth promoters in agriculture. It is also a part of JPI AMR, Global AMR R&D, and STRAMA itself to address this issue globally. It is therefore no coincidence that it has one of the lowest rates of drug-resistant infection in the entire Europe. Despite all these efforts, there is still the risk. That's why Kingdom of Sweden believes to use antibiotics even more responsibly, increase investment and awareness with community participation, and to be well equipped to deal with it. The Kingdom of Sweden shall stand to continue to address this issue at the international level to fight this battle against the superbugs. Thank you so much.
Thank you, delegate of Sweden. You still have 5 seconds remaining of your time. How would you like to use it?
I would like to use this time to give the time to delegate of Nepal.
You cannot give your time to delegate of Nepal. However, you can yield your time to Australia, right?
Oh yes, Australia.
Okay, so delegate of Australia, you have 95 seconds.
According to WHO, World Health Organization, AMR refers to the resistance of bacteria, viral, parasitic, and fungal microorganisms to microbial medicines that were previously effective for treatment of infections. In 2015, Australia had the 8th highest antibiotic usage rate compared to the 28 European nations. Since then and before, Australia has taken several steps to minimize the issue. In 2014, antimicrobial use and resistance in Australia (AURA) surveillance system was established. And in 2015, Australian government released the National Antimicrobial Resistance Strategy 2015-2019, which outlined the framework to address AMR using a One Health approach. Also, there are antimicrobial stewardship programs have been laid for improvement in this sector. Thank you.
Thank you, delegate of Australia. You still had 35 seconds remaining of your speech. How would you like to use your time?
I would like to pass my time to the delegate of Nepal.
Okay, so the rule is like this. You cannot pass the time that has been passed to you more than once. So delegate of Australia, your time will be lapsed right now, and delegate of Nepal will only get 90 seconds. So delegate of Nepal, you have 90 seconds on the clock. You may proceed.
Since with the discovery of antibiotic for the first time, it is recorded as the first antibiotic that can reduce the infection, and it is regarded as magic because it helps the health situation very fast. And the delegate of the delegate of Federal Democratic Republic of Nepal would like to state some things about country Nepal, since it is a developing country, and people of Nepal are undereducated and somewhere aware, but we can't say all are aware about this issue. And due to illiteracy rate, due to illiteracy rate, people are doing self-medication. They use medicine for themselves and by themselves. This is the main reason in Nepal why the antimicrobial resistance is increasing. So Nepal has done different action in this situation. Health insurance is also used by Nepal government in 2016-17.
Thank you, delegate of Nepal. So you still have, yes, Republic of Korea. How would, what's your, to what point do you raise your hand?
Republic of Korea wants to raise a point on information.
Yes, so you have the floor, delegate of.
So yeah, as federal, as what's this? Oh yeah, okay. Now, can I proceed? Like ask question?
Sorry? The Republic of Korea, would you like to ask a question to the delegate of Nepal? You may go ahead.
Hello, am I audible?
Yes, ma'am, you are.
Okay, so Nepal, how you are investing the insurance, like how you are investing the budget which is allocated for health insurance in Nepal in order to decrease the antimicrobial resistance in your country?
Okay, so delegate of Nepal, would you like to answer this question?
Yes.
You may proceed.
Since Nepal government has brought health insurance policy in Nepal, many people of poor economic condition, rather they do not use medicine by themselves, and first they consult to the doctor. Only they use the antimicrobial drugs, which helps to reduce the antimicrobial resistance in Nepal. Thank you.
Thank you, delegate of Nepal. Next up, we have the delegate of Philippines for 90 seconds.
Antimicrobial resistance is a global, multifactorial, and complex problem that is intrinsically linked to human health, animal health, food production, agriculture, and environment. AMR, however, in Philippines is a national priority. In 2015, answering to the call of WHO, the 68th World Health Assembly on May 2050, Philippines with Department of Health took a historic step in finalizing Philippines' action plan to combat AMR. Similarly, in 2018, with the support from United Nations Food and Agriculture Organization, Philippines launched a campaign on responsible use of antimicrobials. However, in low and middle income countries like Philippines, there is a critical gap in research field and development of new antimicrobial medicines, vaccines, etc. And also in aquatic and fishery sector, Philippines is ranked among top fish producing country, but there are still a gap that are to be filled. In response, there are many interventions, but however, more of the interventions are needed to find lasting solutions to the problem. Thank you.
Thank you, delegate of Philippines. You still have 5 seconds remaining. How would you like to use your time?
I would like to pass the remaining time to Vietnam.
Thank you, delegate of Philippines. Next up, we have delegate of Vietnam for 90 seconds. Yes, delegate of South Africa.
Delegate of South Africa would like to suspend the general speakers list and would like to propose the moderated caucus topic.
Okay, delegate of South Africa. That motion will be entertained after, since Vietnam was already recognized So let Vietnam finish and let United Kingdom be the last speaker, and then we'll take your motion.
Thank you.
Okay, so Vietnam, you have 90 seconds.
Thank you, Chair. Infectious disease remain an important threat to Vietnam and also have an increasingly complicated pattern. The proper use of antibiotics treating this disease is crucial. As stated by Vietnam's Minister of Health, the Socialist Republic of Vietnam understands the severity of the AMR as it has faced the outbreaks of SARS 2003, measles 2014, surgical site infection 2013 as well. Today, 1 in 10 patients in Vietnam suffers from hospital-acquired infections along with the increasing prevalence of MRSA and CRE. Not only that, Vietnam being the third major exporter of fish and fishery products in the world has also faced a great drawback during exports to European Union and Japan due to the presence of AMR in their aquaculture. So Vietnam progressively focuses on improving the quality of life along with the betterment of other food chain systems. Being said that, Vietnam is the first country in WHO's Western Pacific region to approve National Action Plan in 2013 and has signed AID Memo in June 2015 to combat AMR. So given the situation and the frequency, Vietnam is open to work under the plans and policies of UN with greater approach in coordination with other countries to fight against AMR. Thank you.
Thank you, Delegate of Vietnam. You still have all of the time that's remaining with the Delegate of Vietnam.
Time has lapsed, Chair.
Okay, so next up we have, before we move on towards our last speaker, let's take the motion raised by Delegate of South Africa. If we have a majority vote, then we'll take up with the last speaker and move towards another topic. If not, then we'll continue with the GSL. So how many of you propose the motion raised by Delegate of South Africa as to suspend the GSL? You may tick the yes mark. That was to suspend the GSL and move forward with the moderated caucus. So if you propose, then you may tick. If you oppose, then you may cross.
Just to remind you, delegates, you cannot stay idle without voting. You either have to favor for yes or no. You cannot stay still in the committee session.
So we have United Kingdom, United States of America, Fiji, and then we have, yes. So these three delegates, what's your stance? We have Indonesia, Fiji, USA. Please give your stance on the vote. So you have to go to the participants column, and then you'll see the green tick button and the red cross button. You then can click in either of those. If you want to suspend the GSL, you may tick the red button which says cross. If you want the motion to pass, you may tick the green button which says a tick. So we have still the delegate of Indonesia who needs to give their stance of voting. Delegate of Indonesia, are you there with us? Are you facing any difficulties with the voting? Then you may ask me by unmuting yourself. Indonesia, are you there? Okay, no worries. I'll just be counting the votes then. Yes, delegate of Indonesia, what is your question? Yes, so you have raised your hand, delegate of Indonesia. Do you have a question regarding you? If anything, then you can raise your hand or unmute yourself and then ask the question. If not, you may type your stance in the chat box. If it's a yes, yes. If it's a no, no. So far, we have about 8 yeses and 7 no's. Um, so let me count again. One, one, two, three, four, five, six, seven, eight. So we have 8 tick marks, and we have 1, 2, 3, 4, 5, 6, 7 crosses. Okay, so since there are more tick marks than crosses and we are missing few delegates as we had before in the roll call, so we'll just pass this motion raised by delegate of Korea just because there were more green marks than the red marks, that's why. So delegate of South Africa, you may raise your motion again. However, before that, we'll move towards our last speaker for this GSL. Delegate of United Kingdom, you may start your speech. You have 90 seconds.
Excuse me, Chair.
Yes.
I guess we were supposed to have Russian Federation after Thailand after delegate of Vietnam.
Yes, so we were supposed to have Thailand before, after Vietnam, but delegate of South Africa raised a motion to suspend this GSL. So before suspending this GSL, we'll take our last speaker because they had reserved their position as the last speaker. And then after 2 or 3 moderated caucuses, we can then have the delegate of Thailand, Russian Federation, Nigeria during the second round of GSL that we'll be having after the moderated caucus. So we can preserve this list of Thailand, Russia, Nigeria, and Fiji. And then once we are done with the moderated caucuses, we can give them their turn firsthand itself. So delegate of United Kingdom, you have 90 seconds.
Greetings, DICE members and fellow delegates. With prior permission of the DICE, the delegate of United Kingdom would like to start. AMR is a complex issue of global concern with severe economic and health consequences. Despite the initiatives developed and interventions made at various levels, the prevalence of AMR is in an increasing rate. The UK government has long been an advocate of actions to address this issue. Recognizing the urgent need for action, our government has developed its 20-year vision against AMR, contained and controlled. We aim to achieve this vision through a series of 5-year national action plans. We are determined to achieve our vision and have set 9 ambitions that will gradually lead us to our goals. Keeping in mind the intensity of this issue, the UK believes the following interventions could prove to be effective: providing support to the low and middle-income countries to build lab and surveillance capacity, incentivizing the pharmaceutical companies that contribute to the production of newer antibiotics, guidance and advice to the countries in policy-making regarding AMR through WHO, improvement of infection prevention and control practices to water sanitation and hygiene projects. With this, the UK calls on all the member states of the WHO to be ready, willing and engaged to play their parts for devising effective ways to tackle this threat to humanity. I'd like to yield my remaining time for the question.
Thank you, delegate of United Kingdom. Okay, if there are any questions for the delegate of United Kingdom, you may raise your hands and then ask the delegate. If not, then we'll be taking the motion raised by delegate of South Africa. Um, However, delegate of Thailand, Russia, Nigeria, and Fiji, you will get your turns once we are done with the moderated caucus. Okay? Since GSL never ends until the end of the conference, your GSL will be paused right now and then you'll be given a chance later. Yes, Republic of Fiji, what's your question?
Well, after listening the delegate of United Kingdom, I have a question for that by developing new antibiotic, how could we tackle the AMR?
Okay, Delegate of United Kingdom, would you like to answer this POI?
So when the antibiotics that are present do not work, then basically the newer antibiotics that are more effective will help to prevent AMR, as we can help prevent AMR by from the beginning itself, before the organisms resist the newer antibiotics.
Can I ask?
Yes, so you have to say plead to follow up. So if you want to ask the question again, you're supposed to say plead to follow up. And then if that's a necessary question, then the DICE members will recognize and then give you the chance. Is that fine?
Okay. Plead to follow up.
Yes, Delegate of Fiji.
Well, as delegate of United Kingdom mentioned, by discovery of new antibiotic, we can improve the AMR from the beginning. But seeing the history of the antimicrobial resistance, adding new antibiotic lead us more problem of the AMR. So how can it be the cause to tackle the AMR?
Thank you, Republic of Fiji. Delegate of UK, would you like to answer that?
Sure. Yeah, my fellow delegate of Fiji is absolutely correct that the antibiotics that they develop resistance. However, but the antibiotics that have already developed the microorganisms that have already developed resistance uh, the newer antibiotics will help to treat the infections that are resistant. So it is more on not on the prevention side, but it helps to combat the AMR.
Thank you, Delegate of UK. Yes, Delegate of France.
I was basically wanting to request if I could also come in line with the delegate of United Kingdom and answer the same question, if it's okay then.
So you want to answer the question that was raised by Fiji to United Kingdom?
If in case the delegate of Fiji wants to follow up with the same question.
No, Delegate of France. Once you get your turn, once you yourself give a speech in the GSL, then only you can answer the question. Otherwise, you cannot answer in place of United Kingdom. Okay?
Okay, that's fine.
Okay. So Russia, what's your point?
For the point of information.
For?
Does UK have developed any other technique other than developing new antibiotics to tackle the antibiotic resistance?
Okay, so Delegate of UK, would you like to answer that?
Yes, so the United Kingdom has developed two main strategies that are 5-year national action plan and a 20-year vision, which includes which has 9 ambitions that ultimately lead to the achievement of our 20-year vision, which includes which drives innovation and helps we are planning to minimize infection, minimize the environmental spread, protect the animal health and welfare, provide safe and effective care to the patient, support sustainable supply and access, demonstrate appropriate use of antimicrobials, and also engage the public on AMR. The United Kingdom has also helped to support the low and middle income countries as well through various funds like Fleming Fund, UK Aid, and has invested in WASH projects in more than 20 countries, focusing mainly on the low and middle income countries. So that's it.
Thank you, Delegate of UK. So, Delegate of South Africa, you may raise your motion once I call upon the floor. Are there any motions on the floor?
The delegate of South Africa would like to propose the moderated caucus topic, sales of antibiotics over the counter in pharmacies. 10 minutes with 1 minute per speaker.
You may type your motion in the chat box for everyone's visibility. Are there any other points or motions on the floor? You may raise your hands. Yes, Delegate of Nepal, what is your motion?
The delegate of Federal Democratic Republic of Nepal would like to raise a motion on food safety connected to antimicrobial resistance with a total timing of 10 minutes and individual time of 30 seconds.
Thank you, Delegate. You may type your motion in the chat box. Now we'll be taking one last motion by the Delegate of United Kingdom. You may state your motion.
The delegate of United Kingdom would like to start a moderated caucus on AMR and the role of environmental hygiene in AMR, in preventing AMR. For 20 minutes with individuals.
You may type your you may type your motion in the chat box.
Excuse me, Chair.
Yes.
Shall we have the voting?
Yes. So we have got three motions, one by Delegate of South Africa, the other by Delegate of Nepal, and the other by United Kingdom. Rest of you who had raised their hands previously, you can raise your motion in the other round of the moderated caucus. Okay, by the order of importance and by the order of time limit. Okay, so Delegate of UK, you are advised to raise a motion with individual speaking time being 60 seconds so that we can entertain more speakers in the moderate caucus. That would be beneficial for everyone. So with the order of importance, let's have the motion of Delegate of South Africa voted first. Uh, the okay, so the motion is sales of antibiotics over the counter in pharmacies uh, with 10 minutes time, individual speaking time being 60 seconds. Those who want this motion to pass, you may tick the yes mark. Those who want this motion to not pass, you may tick the cross mark. So Russia, Albania, Korea, Thailand, Sweden, please cast your votes. So give me 1 minute, I'll just count the votes. Those who have not voted are um, okay, so
Share.
everyone has voted yes.
There are 9 votes for the motion and 7 against.
Thank you, Delegate of United Kingdom. Thank you, Moderator. So with clear majority, this motion passes. So Delegate of South Africa, would you like to be the first speaker or the last speaker?
Delegate of South Africa would like to go at the end.
Okay. So the rest of the 2 delegates, that's Nepal and United Kingdom, though your motion has not passed in this particular moderate caucus, you can re-raise your motion later on by rephrasing it a little bit. Since you cannot raise a same motion twice, you can rephrase the motion and raise it again, okay? So those who are wishing to speak on this particular moderated caucus, you may raise your hands. And delegates, one point to consider is that everyone is supposed to jot down whatever has been spoken in this moderate caucus so that this will be helpful while you are making the working paper. Make sure you jot down the topic of the discussion, the points made by each delegate, and other major things that and the other major questions or points that have been raised in this motion, because this will be important while you draft the resolution or write it in the working paper. Okay, so those of you who wish to speak in this particular moderated caucus, you may raise your hand or mention your name in the chat box. The DAS members will recognize you.
Delegate of South Africa, do you want to be the first speaker or the last speaker?
Delegate of South Africa would like to be the last speaker.
Thank you, Delegate. Thank you very much.
Okay, so I've drawn the line in the chat box. You can start mentioning if you want to speak in this moderated caucus, or you can raise your hand. Okay, we have delegate of Nigeria, followed by delegates. You are supposed to untick the votes that you've casted and raise your hands if you want to speak, followed by delegate of United Kingdom. You may lower your hands, Nigeria and United Kingdom. Your name has been noted, followed by delegate of Nepal, followed by delegate of Fiji, followed by delegate of Russia, so any more speakers, you may raise your hand. As you would want to speak, you may type your name or your country's name in the chat box. Okay, as the first speaker, we have followed by delegate of Philippines. Okay, delegate of Nigeria, you have 60 seconds.
Good afternoon, everyone. The delegate of Federal Republic of Nigeria would like to speak on the sales of antibiotics over the counters. Pharmacists are important members of the healthcare system who play a major role in medicine use and the provision of advice regarding their appropriate use. The shortage of licensed prescribers and pharmacists has led to myriad of problems, including antimicrobial resistance. Although the prescription-only medicines, which include antibiotics, are not to be sold over the counter, the Federal Republic of Nigeria recognizes that the lack of an efficient quality control measure and regulatory bodies have allowed the pharmacists to sell the prescription-only medicines like antibiotics over the counters, and the regulations are impeded by the fragmented nature of the pharmaceutical market. So the delegate of Federal Republic of Nigeria suggests that it is important to enforce the drug quality monitoring and regulation while involving the physicians both in public and private sectors. And the delegate believes that the monitoring and evaluation system needs to be in place along with the establishment of transparent feedback loops. Yeah, that's all. Thank you.
Thank you, delegate of Nigeria. So South Africa, and then we have the delegate of Vietnam because they have raised their hand. Um, so next up, we have the delegate of United Kingdom for 60 seconds.
So the sales of antibiotics over the counter in pharmacies is a very big issue everywhere in the world, and also in the United Kingdom, uh, it is a very big issue. And according to a survey, 1 in 3 people are on the antibiotic course every year in the United Kingdom itself. However, by implementing our strategies, national action plans, they have been able to reduce the sales of veterinary antibiotics by 40% and in humans and use in humans by 7.3% by optimizing surveillance and developing our laboratory capacities.
Thank you, delegate of UK. Next up, we have delegate of Nepal. So before that, director, moderator, ma'am, are you there?
Yes, sir.
So do you have the Chrome extension with you right now?
Right, not.
Okay, so
I guess I have the extension.
okay, so you can now like copy the names and then work on the filling the extension while we are having the delegate of Nepal speech, and after that we can switch turns. Okay, so next up we have delegate of Nepal for 60 seconds.
The delegate of Federal Democratic Republic of Nepal would like to state that controlling of antibiotic from the pharmacy and wholesale of the medical shop is very necessary for controlling of antimicrobial resistance. In Nepal, Department of Drug Administration established in 1979 conduct regulation and checking of pharmacies and medical shops whether they are giving antimicrobial drug without any prescription or not, and it also check the quality of drug for the health of public, and it regulate monitoring and checking of pharmacy whether they are under the control of pharmacist and MBBS doctor or not.
Thank you, delegate of Nepal. Next up, we have delegate of Fiji for 60 seconds.
A very pleasant afternoon, everyone. The pharmaceutical sector plays an important role in providing safe and affordable medicines to the citizens of any country, and and all of the countries are facing the problem of the antimicrobial resistance and the problem of the sales of the drugs over the counter. According to the research in the Fiji, and the Fiji News stated that the College of General Practitioner is concerned by pharmacists continuing to prescribe drugs without prescription, and they are taking advantage of their position and selling the drugs without the prescription in the OTC way. And for to counter this, the Fiji government has acted the national AMR plan and put forwarded the strategies like optimization of the AMR, which will surely solve the problem of OTC sale. Thank you.
Thank you, Delegate of Fiji. Next up, we have the Delegate of Russian Federation.
Antibiotic misuse and overuse and the resistance of these practices have caused a series of global health problems. An average 93% of people reported to have obtained their most recent antibiotic from pharmacies. Although antibiotic is a prescribed medicine, in many countries, it is frequently being supplied without prescription. In Russia, medicine selling the medicine without prescription is unlawful, and there is a new law in the process of formation which will allow to sell the medicine online with with prescription, and it will allow to have you the medicine at home. Thank you.
Thank you, Delegate of Russia. Next up, we have Delegate of Philippines for 60 seconds.
Over-the-counter sales of antibiotics is one of the major issues in surge of antimicrobial resistance, especially in Western Pacific region, where antibiotics are easily available in pharmacies. Due to ineffective strength and surveillance and limited studies conducted in over-the-counter use of antibiotics, it has created a vast surge in antimicrobial resistance. Since causation of AMR is interrelated and intersectoral, it requires collaborative multidisciplinary work at local level. The Republic of Philippines stands at initiatives of antimicrobial smart use that should be launched in Philippines to rectify the common misconception that patients have about antimicrobials by clarifying that antimicrobials are not anti-inflammatory drugs. Antimicrobials are potentially dangerous drugs. Simple diseases like diarrhea and upper respiratory tract infection can be cured without antimicrobials. Thank you.
Next up, we have Delegate of Sweden for 60 seconds.
Thank you so much, Honorable Chair. Fellow delegates, there's a slogan: the more we use antibiotics, the more we lose antibiotics. And over-the-counter drugs refers to the medication that can be purchased without any medical prescription. And no doubt they are the important class of medicine that can be sold directly to the consumer. But it is a global health problem and is also a major cause of antibiotic misuse and overuse, which may result in antibiotic resistance, recurrent infections, increased cost, and adverse effect of the treatment. That's why OTC drugs should be taken in a very careful way. We have to make sure to check the label before we purchase any kind of OTC drugs, inform our doctors if we happen to take another drug, and take the medicine exactly as directed by the pharmacist. Thank you so much.
Next up, we have Delegate of Vietnam for 60 seconds.
Today, the sales of antibiotics over the counter in pharmacies has played a very important role in facing the antimicrobial resistance in today's world. In Vietnam as well, patients tend to avoid medical institutions and prefer to self-diagnose with the medications from the over-the-counter drugs. But in Vietnam, the rate of antibiotics being sold without prescription is almost as 88% in urban areas and 91% in the countryside only. So the Ministry of Health has ordered that all the drugstores to be connected to the National Medicine Database via the internet with the aim to decrease the use of drugs without a prescription. In this, Vietnam, though has understood the regulations and has acquired the pharmacies to invest, but we can still see the lack of action in them. So, although the deputy director of the HCMC Department of Health has stated licenses will be taken away from the pharmacies that continue to disobey, but it is still in lack in action, due to which Vietnam strongly adheres to control the over-the-counter prescriptions of antibiotics. Thank you.
Next up, we have delegate of South Africa for 60 seconds. Co-chair, are you there?
Although antibiotics are prescription-only medicines in many countries, they have frequently been supplied over the counter without a prescription across the world. Research has shown that antibiotics were freely available for purchase on the internet without a prescription for a buyer, which encourages self-medication and therefore no doubt has a huge contribution to antimicrobial resistance. Even South Africa is one of the countries where over-the-counter sales of antibiotics is widespread. Though it may seem strange, but the shortage of licensed pharmacists and the lack of specific training on antibiotics for pharmacists, improving the rational use of antibiotics in retail pharmacies is not really easy. So, collaborative effort is mandatory to reduce this practice, and action should be taken globally as soon as possible. Thank you.
Thank you, delegate of South Africa. Vice Chair, are you there with me?
Yes, Chair, I'm here.
Okay, so moderator, director ma'am, is your screen shared? Okay, so with this, we have come to the end of our moderated caucus number 1. We can have one more moderated caucus. I'll pass the floor to our co-chair. You can moderate the session for a few minutes. I'll get back to you in a few minutes.
Thank you very much, Chair. So, delegates, since we have come to the end of the motion that has been raised by delegate of South Africa, now we'll be moving towards the other motions. So, in absence of any other motions, we'll come back to the general speaker list back. So, for now, delegates, are there any motions on the floor? Delegate of Sweden, followed by, so delegates will take 3 motions at once. So we just have one motion that is left to be proposed by delegate of Sweden. So any other delegates wishing to propose a motion on the floor, please raise your hand. So delegate of Sweden, followed by delegate of Nigeria, followed by delegate of United Kingdom. Yes, delegate of Sweden.
The delegate of Sweden would like to ask for the motion to moderate caucus on the topic economic implication of antimicrobial resistance.
Or the total time period of?
For the total time period of 1 minute for 1 minute for about how many minutes? 1 minute per speaker with a total duration of 6 minutes.
Okay, so delegates, I will try to help you in order to rephrase the motion that you have just raised. Is it fine with you?
Yes.
So this is the way that you have to say. The delegate of Sweden would like to raise a moderated caucus on topic for the total time frame of this with individual time period of these seconds. So first you have to mention the total time period followed by the individual time period in seconds. Is that clear, delegate?
Yes, sure.
Yes, please repeat it again.
The delegate of Sweden would like to raise moderate caucus for about 60 seconds each speaker with a total duration of 6 minutes on the topic economic implications of antimicrobial resistance.
Thank you, delegate. Please drop the motion in the chat box. Delegate of Nigeria.
The delegate of Nigeria would like to raise a moderated caucus on the topic use of antibiotics in agriculture for the total time period of 20 minutes with individual speakers' time being 60 seconds.
Thank you, delegate. Please drop your motion in the chat box. Delegate of United Kingdom.
The delegate of United Kingdom would like to raise a motion to start a moderated caucus for 15 minutes, 1 minute each for individual speaker on the topic AMR and the role of environmental sanitation and hygiene in preventing it.
Thank you, delegate. Please drop your motion in the chat box as soon as possible so that we proceed towards voting. So, delegate, I have just mentioned the format that you need to use in order to raise the motion so that it will be clear to every one of us present in the committee to recognize the topic, individual time frame, and the total time frame. Don't forget to mention the time frame as well, delegate of Nigeria. So I've been seeing a few delegates being actively participating in the committee session. That's a very good moment for us. But I would like to encourage each of you to speak, because if you refrain from speaking, then that is not the way you learn. So make sure that you come up with at least general speaker list or a motion so that that will be easier for you to collaborate with the other people as well. So as we have three motions that has been raised by delegate of Sweden, followed by delegate of Nigeria, followed by delegate of United Kingdom in the chat box, we may proceed towards the voting for the motion that has been raised by delegate of United Kingdom. That is, role of environmental sanitation and hygiene in prevention of antimicrobial resistance for total time frame of 15 minutes, where individual time frame is 60 seconds. So delegates voting for the motion that has been raised by delegate of United Kingdom, please tick mark as yes, and the delegates voting for the motion that has been raised by delegate of United Kingdom, please tick mark as no. Six. We are voting for the motion that has been raised by. So delegates, we are voting for the motion that has been raised by delegate of United Kingdom. For now, we have 5 yes and 7 no. Delegate of Thailand, please mention your voting stance. So, delegate of Indonesia, please mention your voting stance. Delegate of United Kingdom, please mention your voting stance. So for now, we have 6 yes and 9 no. This motion clearly fails. Moving towards the motion that has been raised by delegate of Federal Republic of Nigeria, that is on topic use of antibiotics in agriculture and its role in AMR for total time period of 10 minutes in which individual will be given 60 seconds. So delegates voting for the motion that has been raised by Federal Republic of Nigeria, please tick mark as yes, and the delegate voting against the motion, please tick mark as no. We are voting for the motion that has been raised by Nigeria. So delegates, don't assume to stay idle while the voting session is going on. You have to be clear about your voting stance. So delegate of Albania.
Yes, yes.
Thank you for mentioning your voting stance. Make sure that you uncheck the bottom once the voting stance is over. For now, we have 7 yes and 8 no. By a simple majority, this motion clearly fails. We just have one motion that has been left now, which was proposed by delegate of Sweden, that is economic implication of AMR with 6 minutes as total time frame and 60 seconds as individual time frame. So delegates, please uncheck the button that has been used for voting previously. Delegate of yes, delegate of so now we are voting for the motion that has been raised by delegate of Sweden, that is economic implication of AMR with total time frame as 6 minutes and individual time frame as 60 seconds. Delegates voting for the motion that has been raised by Sweden, please tick mark as yes. Voting against, please tick mark as no. Please be quick. So delegate of Albania, could you please mention your voting stance? So we have 8 yes and 6 no for now. This motion clearly passes. So delegate of Sweden, would you like to be the... So there has been confusion created. We first voted for the motion that has been raised by delegate of UK, followed by the motion that has been raised by delegate of Nigeria. And since both of the motion failed, we voted for the one that has been proposed by delegate of Sweden. So that motion passed with simple majority as 8 yes and 6 no. Is that clear, moderator?
Yes.
So, okay. So delegate of Sweden, would you like to be the first speaker or the last speaker?
I'd like to be the first speaker.
First speaker. So I would like to request the moderator to mention the name of Sweden at the first. Followed. So delegates willing to speak on this motion, please raise your hand. Delegates. Delegate of Nigeria.
Excuse me.
Followed by delegate of United Kingdom. Yes, delegate. You are excused.
I want to ask one question.
Sure, delegate.
Why the motion raised by a delegate of Nepal is not present in voting before?
So delegate, what happens? Okay. So what happens is we take 3 motion at once. So we raised the motion that has been, we took the motion that has been raised by delegate of Sweden, Nigeria, and United Kingdom. But what happens is we cannot recognize all the raised hand at once. That is why we just take 3 motion at once. And if you feel like you have not been recognized, you need to raise your hand when we ask for the motion the other time as well. Is that clear, Nepal?
For the first time, before this, delegate of Nepal has raised motion already, and first time one motion was passed, and we have discussed about that motion, and for the next time, why that motion was not present in voting.
So, delegate, what happens is once we took 3 motion, so if the first motion passes, the second 2 motion already fails. So for now, what happened is we first voted for delegate of Nigeria. That failed. That is why we moved towards the motion that has been raised by delegate of UK. If the first voting stances would pass, we'll not move towards the second and third motion. Is that clear, delegate?
Yes.
So if you feel like that has been failed, you need to rephrase it again and raise the hand in order to propose in the committee. Thank you so much for the question, delegate of Nepal. So delegate willing to speak on the motion that has been raised by delegate of Sweden, that is economic implication, please raise your hand. For now, we just have delegate of Sweden, followed by delegate of Nigeria, followed by delegate of UK. If the delegate would not raise their hand by themselves, the dice will compel the delegate to speak. So please don't force us to be rude towards you. Please raise your hand if you are willing to speak on this motion. Followed by delegate of Nepal. Followed by delegate of Philippines. Followed by delegate of Russian Federation. Thank you, moderator. For now, delegate of Sweden, you may have the floor for 60 seconds.
Thank you, co-chair. Fellow delegates, according to World Bank, drug-resistant diseases could cause low-income countries to lose more than 5% of their GDP, push up to 28 million people, mostly in developing countries, into poverty by 2050. And that obviously is a great economic loss. And it's pretty sure because once a bacteria gets resistant, it becomes so difficult for us to treat even the common infections, leading to increased treatment cost, mortality, morbidity that affects the lifestyle of the people. So increasing awareness by collective action, multi-sectoral collaboration, promoting infection prevention, and strengthening the government with good international cooperation could be the solution for it. Thank you so much.
Thank you very much, delegate. Delegate of Nigeria, you may have the floor for 60 seconds.
In a lower middle income country like the Federal Republic of Nigeria, with majority of the population surviving on or under $3.10 per day, poverty remains the major contributor to the emergence of AMR. Many individuals prefer not to finish antibiotic treatment or only purchase what can be afforded, and self-medication is a common practice. As a result of economic difference, the poor are more likely to rely on the lower quality services due to the reasons of their cheapness. So the emergence of antimicrobial resistance has led to mortality. Economic burden has increased almost exponentially as it leads to longer hospital stays, the need for more expensive medicines, and financial challenges, which in turn has exaggerated the poverty. So, the delegate of Federal Republic of Nigeria believes that the economic implications is one of the major area which should be concerned. Thank you.
So thank you, delegate. Delegate, please keep in mind that we have to respect the time frame that has been mentioned. As we have requested you to have the floor for 60 seconds, you need to be specific within the time limit. If you feel like your speech has not been completed, you may leave text in the chat box so that we may add your name after the speaker that has been mentioned. You may re-speak in the topic, but make sure that falls within this total time frame as 6 minutes. Plus, please don't elongate your speech more than 1 minute because that will affect the consequent speakers in this topic. For now, we have Delegate of United Kingdom. You may have the floor for 60 seconds.
Economic implications of AMR is massive worldwide. The World Bank estimates that an additional 28 million people could be forced into extreme poverty by 2050 through shortfalls in economic output unless resistance is controlled. Though it affects countries worldwide, the low and middle income countries are expected to be the most severely affected ones. Though the fight against AMR is not at all cheap, putting resources into stopping AMR is undeniably the highest yield investment a country can make in the present context.
Thank you, Delegate. For now, we have Delegate of Nepal.
Excuse me. Time
Yes,
was not
Delegate.
set. Time was not set.
Okay, so moderator, could you please set the time?
The delegate of Nepal believes that economic implication in different sector for providing awareness and for uh, decreasing the burden of antimicrobial resistance is very important to the developing countries since with the implication with the economic implication we can aware the public about antimicrobial resistance from social media like radio, television, and other YouTube channel like that. And we also can conduct a road drama about antimicrobial resistance and its effect towards the public health. Thank you.
Thank you, Delegate. Delegate of Philippines, you may have the floor for 1 minute.
The cost of AMR to national economies and health system is significant. Putting attention into healthcare system, when the first line drugs no longer work for need to resort to the second line antimicrobials, which are not only more expensive but also necessitate closer monitoring. Thereby, AMR translates to increased costs due to prolonged illness and hospitalization. Subsequently, patients become more at risk of nosocomial infection, which are even more difficult to treat. In a paper entitled AMR Tackling a Crisis for the Health and Wealth of Nations, the threat of AMR is projected to intensify till 2050, leading to 10 million deaths annually and global economic losses approximately 100 trillion US dollars. Moreover, countries such as Philippines, where malaria, HIV, and TB cases are high annually, along with AMR, are expected to suffer more due to insufficient, although AMR Action Fund and other funds initiative could fill a major funding gaps. However, Philippines expects more of intervention and funding from nations that are needed to find lasting solutions. Thank you.
Thank you, Philippines. Please limit your speech within 60 seconds at the time. For now, we have Delegate of Russian Federation.
When infections are treatable with antimicrobials, people can be cured and further spread within the population can be readily contained. When the bacteria become drug resistant, it causes the use of more expensive and intensive drugs and long hospital stays. This also increases the cost of operative and post-operative state, and it also becomes risky for the patient, which is due to the requirement of more intensive care. This caused huge economic loss, which could have prevented with wise use of antibiotics. Thank you.
Thank you so much, Delegate. So, Delegate, if you have noticed the time, it's 4:01 and we were supposed to have break at 4. So for now, what I expect is one motion from you so that we could suspend the meeting for the other committee session in order to enter to the break. So we cannot directly enter to the break if we did not get any motion from you people. So delegate, are there any motions on the floor? Yes, delegate of United Kingdom.
Point of parliamentary inquiry.
Yes, delegate.
Are we permitted to ask questions during moderated caucuses?
So you were not permitted to ask question according to the UN and USA format, but since most of the people are beginners, we have been agreeing to the fact that you are in need of some help from the DICE member and you need to clarify your confusion in order to continue the session. That is why we address as the question or is that will not be promoted from the other committee session. Is that clear, delegate?
Yes.
Thank you so much, delegate. So are there any motions on the floor, delegates? Yes, delegate of United Kingdom.
Motion to suspend the committee session for a break.
So you need to rephrase it, delegate. You need to follow the format the delegate of United Kingdom would like to.
Okay, the delegate of United Kingdom would like to raise a motion to suspend the committee session for a break
Thank
for
you,
30
delegate.
minutes.
Thank you, delegate. So are there any other motions on the floor? Yes, delegate of Australia.
The delegate of Commonwealth of Australia would like to raise a motion for inappropriate prescribing, that is wrong dose and timing or frequency, as one of the major cause of AMR for 5 minutes, total time of 5 minutes, with individual
So
time of
delegate, okay, delegate, is that a moderated caucus or a motion for unmoderated caucus?
moderated caucus.
Thank you, delegate. Yes, delegate of South Africa.
Point of parliamentary inquiry.
Yes, delegate.
A delegate of South Africa previously raised its hand to speak for the moderated caucus, but it was not recognized. So, what is its procedure? Like, are we
So
supposed to?
delegate, what happened is the total time frame mentioned was 6 minutes. Okay, so the individual time frame was 60 seconds. So that means we could only accommodate 6 speakers at once, right? That is why you were not recognized delegate.
I get it. Thank you so much.
Thank you, delegate. So for now, due to the itinerary that has been provided by the organizing committee, we'll be voting for the motion that has been raised by delegate of United Kingdom in order to suspend the meeting for break. So basically, we were on a break for 30 minutes, and now we are waiting for the delegates in order to start the formal committee session 2. Over to you, Chair.
Okay, so far we've had two moderated caucuses and one round of GSL.
So we actually had a moderated caucus that was proposed by delegate of Sweden, in which 6 of the delegates spoke, and after that we suspend the meeting and we went for a break. So before that, we have not resumed any general speaker list, but we encouraged a motion, and then we had a motion discussed in the committee session regarding the economic implication of AMR.
Oh, okay, thank you for the update. I hope the moderator and the director are tagging that in their reports.
I assume that. Do we have director and moderator here?
Yes, Chair.
Okay, so now I hope everyone is back. If you are back, then okay. So how many of delegates? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Okay, we have 13 delegates present. I think it's almost a majority, so we can start with the committee sessions. So delegates, are there any points or motions on the floor? But before that, I think we should take the roll call to determine the majority votings because we have had a decrease in the number of delegates. Okay, so moderator, can you take the roll call for this?
Yes, sure. Delegate of the Republic of Indonesia. Republic of Indonesia. All right. Republic of Korea.
Present and voting.
Mm, Delegate of United Kingdom.
Present and voting.
Delegate of United States of America.
Present and voting.
Delegate of the Kingdom of Thailand.
Present and voting.
Of Australia.
Present and voting.
Delegate of the Republic of South Africa.
Present and voting.
Kingdom of Sweden.
Present and voting.
Delegate of the Federal Republic of Nigeria.
Present and voting.
Delegate of the Republic of Philippines.
Present and voting.
Delegate of the Republic of Fiji.
Present and voting.
Delegate of the Socialist Republic of Vietnam.
Present and voting.
Delegate of the Republic of Albania.
Present and voting.
All right, thank you. We have 12 delegates who are present and voting.
So, moderator,
Hello.
can you get the total number of
De-
delegates who have told present or present and voting, the total cumulative number?
Delegate of Indonesia present and voting.
Yes, thank you.
So, moderator, एउटा कुरा चाहिँ I'd like to address. So present अथवा present and voting भन्ने पनि until and unless we are in a resolution session, the stance of the voting won't matter because as long as the delegates are present or present and voting in the committee, उहाँहरूको stances चाहिँ it will remain the same because they will all be eligible for voting. So you can tell me the total number of delegates present, represent, and voting. So you can tell me the total number of delegates and they अनुसार divided by 2 and plus 1 गरेर चाहिँ नि tell me the majority of this committee, right?
Sir, we have 13 votes अहिलेसम्म. Only 13 divided by 2 plus 1 is approximately 8. Yeah, I'm sorry, 267.
So the simple majority of this committee will be 7. So without further ado, let's move on. Delegates, are there any points or motions on the floor? You may raise your hands.
Delegate of United Kingdom has raised her hand.
Yes, so Delegate of United Kingdom, what is your motion?
Delegate of United Kingdom would like to raise a motion to commence the general speakers list.
Thank you. Thank you, Delegate. Thank you, Delegate of United Kingdom. The motion is now in order. We will be resuming the GSL. I believe we have the list of previous speakers as well. So yes, so co-chair has mentioned it in the chat box. So whoever is using the screen share might type it according to the order, and then we can resume the GSL.
Director, we have to eliminate UK because the delegate was given chance to speak before the moderate caucus. So we are supposed to place Nigeria instead of UK. Followed by delegate of Fiji.
So if UK, would you like to speak? If UK would like to speak after Fiji, you may raise your hand and I'll recognize you. Any other speakers? Similarly, if you would want to speak after Fiji, you may raise your hands or type your name in the chat box. We will recognize you. So after Fiji, we have Korea. Any more speakers? I see none. So delegate of Thailand, you have 90 seconds. Delegate of Thailand, are you there?
Hello.
Yes.
Hello. Am I audible or not?
Yes, you are audible, sir. You may start with your speech.
Thank you. By the day of discovery of antimicrobial and its continual significant and effective use from long time ago, but during the few decades of the parameters has been changed for the antimicrobials. It is said that if you going to dominate or torture someone beyond limit, they will start against you. The same thing is happening in the context of antimicrobials too. Unwanted and uncontrolled use of antimicrobials has started the rising of resistance for the drugs which are effective before, but they are now showing no effect antimicrobials. AMR occurs naturally over time, usually through the genetic changes. And this adaptation by the antimicrobials has rise to cause a global risk of health. Concerning to the global risk of by AMR, Kingdom of Thailand had been regularly shown as positive efforts and collaborating in global action plans. Thank you.
Thank you, Delegate of Thailand. Next up, we have Delegate Russia.
Sorry, but my internet connection was not able, so I don't know about the topic. What is going on?
Delegate of Russia. You may start with your speech.
No, what is the topic? I don't know about the topic.
Yes, so you're supposed to give a GSL on the agenda.
May
Do
I
you know
start?
about? Yes, yes.
AMR is a natural phenomenon accelerated by the use of antimicrobial medicines. These medicines lose its effect because microbes either change due to mutation or by acquiring genetic information from other microbes. To the prior permission of the head table and the delegates in the House, today we have gathered to discuss extremely relevant issue, that is AMR. According to WHO, it's one of the 8 global public health threats. APUA, Alliance for Prudent Use of Antibiotic, Russian chapter has developed plans for expansion of integral antibiotic resistance monitoring integral antibiotic resistance monitoring onto the national level by using laboratory data of Institute of Antimicrobial Chemotherapy. Researchers of St. Petersburg Polytechnic University have proposed blocking bacterial antibiotic resistance by use of small protein called peptide inhibitor. Russian strategies against AMR, studying the mechanism of microbial resistance, improving measure to control the spread of antibiotic resistance bacteria, developing alternative method and techniques, spreading awareness for developing integracy effort. Thank you.
Thank you, Delegate of Russia. Next up, we have Delegate of Nigeria for 90 seconds.
Good afternoon, everyone. The delegate of Federal Republic of Nigeria would like to emphasize on the fact that the development of AMR over the years has rendered standard treatment ineffective, increasing the rate of morbidity and mortality. According to the legislation, antibiotics are not to be sold over the counter and pharmacies are only allowed to dispense a legitimate prescription for these drugs. The National Strategic Health Development Plan second and the National Action Plan incorporates the One Health approach, and the focus areas are on increasing awareness and understanding of AMR through effective communication, education, and training, research on AMR, and promotion of rational access to antibiotics. Other policies include the National Policy on Quality Assurance for Medicines and Other Health Products, National Agency for Food and Drug Administration and Control Act, Drugs and Related Products Act, and the Counterfeit and Fake Drugs Act. The delegate of Federal Republic of Nigeria emphasizes the need to enforce drug quality monitoring and regulation, along with the establishment of transparent feedback loops to improve the access to affordable and reliable health service, and is of the opinion that we shall together emerge victorious in this ongoing battle against AMR, bringing the world one step closer to a future without superbugs. Thank you.
Is delegate of Fiji audible?
Yes, delegate, you are.
Good afternoon, everyone. Delegate of Fiji would like to start a speech by WHO definition on the antimicrobial resistance as of microorganisms resistance to an antimicrobial drugs or medicines that once was able to treat an infection by that microorganism. Here, resistance is the property or characteristics of the microbe and not the person. Antibiotic resistance at the start just seemed to be nothing until it takes its real form of disaster. Recent reviews in Fiji indicate that drug-resistant microorganisms are present in hospitals, though being most economic established state among the Pacific Islands, it has faced antimicrobial resistance highly. In the cases of diabetic amputations occur at a rate of 1 every 12 hours, and tuberculosis, both human and animal, which seems to be in need of the greater antibiotics with the increasing of the risk of the AMR. Thus, when WHO released its report in 2014 saying that Fiji must focus on the AMR, Fiji, therefore, in November 2015, during the very first World Antibiotic Awareness Week, Fiji as the first Pacific country in order to develop and launch the national plan for antimicrobial resistance with its 5 strategies to overcome the AMR and tackle the AMR in the future, and choose its partner with the CSIRO-led project by the Australian, and with the Australian and Fiji government, it is running 3-year plan since 28 July 2023. Thank you.
Thank you, delegate of Fiji. We have delegate of Korea for now.
Hello all. At the end of 2015, a global action plan on antimicrobial resistance was proposed by the WHO and global AMR surveillance system, which is called SGLAS, and was subsequently initiated. The Centers for Disease Control and Prevention of South Korea established a customized AMR surveillance system for South Korea, which is called as Core Glass, in early 2016. A pilot phase of Core Glass was operated from May to December 2016 with 6 Sentinel hospitals, and phase 1 of Core Glass started in January 2016 with 8 Sentinel hospitals. This research helped in finding out the antimicrobial resistance of several microbials medicines which are used in South Korea. Thank you.
Thank you so much, delegate of Korea. For now, we have delegate of United States of America. So thank you, delegate of United Kingdom. So for now, I would like to request the moderator to notify what was the remaining time of delegate of Korea. Are we having a speaker list now? Do we have moderator here? Moderator?
Yes, the director is this.
So okay. So director, may I know the remaining time frame of Republic of Korea?
We are having general speaker list now, and delegate of Republic of Korea had 25 seconds remaining.
Okay, thank you. So delegate of Republic of Korea, how would you like to yield the time?
The delegate of Republic of Korea would like to yield the time by passing it to United States of America.
So thank you, delegate. So delegate, as the list of general speaker list has been seen empty at now, but general speaker list cannot have less speakers like this. So delegates who are interested to add their name in general speaker list, please raise your hand. If you don't do this, we have to force you to speak and add your name in this list, because we cannot run the conversation with no speaker's name in general speaker list. So, delegates willing to add their name in general speaker list, please raise your hand. You may re-raise your hand, delegate. It's not compulsory for you to speak once at a time. You may raise your hand again and again.
Kingdom of Thailand and United States of America. The delegates have raised their hands.
So, thank you, moderator. I see no one raising the hand in the chat participant sector. So, delegate of Thailand followed by delegate of United States of America followed by delegate of Vietnam. So that
Hello.
much for now. Yes, delegate.
Kingdom of Thailand wants to raise a motion to move into a moderated caucus on topic factors that causes development of AMR in microbes.
So, delegate, for now, I would like to request the delegate of United States of America to present the general speaker list so that we can move towards asking motion in this committee session. Is it fine with you?
Thank you, ma'am.
So, thank you, delegate of Thailand, delegate of United States of America. You may have the floor for 90 plus 25 seconds.
Good afternoon, honorable guests and fellow delegates. Antimicrobial resistance is an increasingly serious threat to United States of America, which causes more than 22.8 million antibiotic resistance infections each year and more than 35,000 deaths as a result. So the United States government has been taking ambitious steps to fight this threat. The White House released the 5 years National Action Plan to combat antimicrobial resistance targeting 2020 to 2025, which mainly focuses across the One Health spectrum. The US government has also established a post incentives which provide funding directly to drug companies to develop new products which can overcome those drugs that are no longer effective. Another effort to combat AMR include the funding offered by the US Department of Health and Human Services directly to antibiotic manufacturers through Biomedical Advanced Research Development Authority BARDA, which was established in 2006. Also, US is also cooperating with the other countries by launching campaign to encourage global organization to make formal commitments that further the progress against resistance. Thank you.
So, thank you, delegate. How would you like to yield the remaining 5 seconds?
The delegate of United States of America would like to heal the time by passing it to chair.
So, thank you, delegate. So, the vice chair has a question for you, delegate. Are you open for the question? Delegate of United States of America, are you open for a question?
Yes.
So, as we have mentioned about global organization to combat the problem in your speech, right?
Yeah.
So, could you please mention what kind of organization you are talking about?
Actually, United States of America has launched a 1 year campaign, 1 year long campaign in 2018 to make aware about antimicrobial resistance. Actually, I was mentioning about the organization of those countries which were cooperating in those campaign.
So, could you please mention the countries which conducted the campaign and the organization of those countries that collaborated with United States of America in order to trade?
Sorry, I had taken this data from Center for Disease Control and Prevention (CDC) of US, and it had mentioned that US has collaborated with other countries, but there were no specific names, so I'm unaware about it.
So thank you, delegate, for being honest that you are unaware, but make sure that you search something reliable information while extracting the reports from PDF as well. So please be specific while you mention it in your general speaker list because DICE can cross question you regarding the speech that you have just presented. Is that okay, delegate?
Yes, ma'am.
Thank you, delegate. So, delegate,
of UK, you have just raised your hand.
The delegate of UK would like to raise a point of information for delegate of Russian Federation. If the delegate agrees to answer any, is open to any questions.
So delegate, what happened is there is the three options in order to yield the time. The one is for to the chair, the one is to the questions, and the other one is to the other delegate. So for now, the delegate has yielded the time to the chair, not for the questions. So your question will not be entertained, delegate. Okay, delegate.
Okay.
So are there any motions on the floor, delegates? So delegates, are there any other motions on the floor? I have seen few delegates mentioning their motion in the chat box directly without saying it verbally. First, you have to mention the motions while I ask for the motion. Now I'm asking for the motion and I show no hands raising. So delegates, are there any motions on the floor? Delegate of Thailand, followed by delegate of.
Yes.
So delegate Deepak Acharya, could you please rename yourself? Yes, delegate of Thailand.
Hello.
Yes, delegate
Thank
of
you,
Thailand.
co-chair.
Yes, delegate.
The Kingdom of Thailand will like to raise a motion to move into a moderated caucus on topic factors that causes development of AMR in microbes for 10 minutes for 1 minute each delegate.
Okay, thank you, delegate. Delegate of
Thank
Nepal.
you.
Yes, ma'am.
So, motion.
The delegate of Nepal would like to raise a motion for a moderated caucus on a topic safety, food safety regarding AMR and controlling of AMR for total timing of 10 minutes and individual timing of 1 minute.
Thank you, delegate. Please drop the motion in the chat box as well. So, since we have two motion, one from delegate of Thailand and delegate of Nepal, we could entertain one more motion at this time. So, delegate, are there any motions on the floor? Delegates, are there any motion on the floor? So we'll be waiting for one more time, delegates, since we could entertain three motions at a time and we just have two. Are there any other motions on the floor? Yes, delegate of Nigeria.
The delegate of Federal Republic of Nigeria would like to raise a moderated caucus on the topic of awareness on antimicrobial resistance for a time period of 10 minutes with individuals.
So thank you, delegate. Would you mind dropping the motion in the chat box immediately? So we have a motion that has been proposed by delegate of Thailand on topic factors that causes development of AMR in microbes for total time period of 10 minutes where each individual will be getting 1 minute. Followed by delegate of Nepal on topic food safety regarding AMR for 10 minutes where each delegate will be getting 60 seconds. And we are waiting for the motion that has been proposed by delegate of Nigeria and the chat box. So the delegate of Nigeria has mentioned about awareness on antimicrobial resistance on total time frame of 10 minutes in which individual will be given 60 seconds. So by the weightage of the motion that has been proposed, we'll be first voting towards the motion that has been raised by delegate of Nepal, that is food safety regarding AMR for the total time frame of 10 minutes in which each individual will be giving 60 seconds. So delegates voting for the motion that has been raised by Nepal on topic food safety regarding AMR
for total time frame of 10 minutes and individual getting a minute, please tick mark as yes. Delegates voting against the motion raised by Nepal, please tick mark as no. We are voting for the motion that has been raised by delegate of Nepal. Please be quick, delegates. So we have 9 yes and 4 no for now. So I want each of the delegates to vote either yes or no. Delegate of Indonesia, may we please have your voting stats displayed? So we have 10 yes and 4 no. This motion clearly passes. Delegate of Nepal, would you like to be the first speaker or the last speaker? Delegate of Nepal, your motion has passed with 10 yes and 4 no.
Speaker.
Would you like to be the first speaker or the last speaker?
First speaker.
Last speaker. Thank you, delegate. So delegate wishing to speak on the motion that has been raised by delegate of Nepal on food safety regarding AMR, please raise your hand. Delegates willing to speak on the motion that has been passed in the committee as food safety against for AMR, please raise your hand. Delegate of Korea. Director, could you please add the name of Korea as a speaker 1, followed by delegate of Fiji. So delegate, we are expecting you to raise your hand as you have voted for this motion and we have been seeing no one being attentive. Please uncheck yes no button for now and raise your hand if you are willing to speak on this topic. Followed by delegate of Nigeria as speaker 3. So delegate, the total time frame is 10 minutes and we could entertain at least 8 speakers at once. So I expect you to raise your hand. If not, we will be picking you on a random basis. Delegate of Sweden, please uncheck your yes button. Delegate of Indonesia, please uncheck your yes button. Delegate of Thailand as speaker 4. Delegates, you voted for yes. I know who all voted for yes. So if you'll not raise your hand on your own, I will pick you out randomly. Delegates willing to speak for food safety regarding AMR, please raise your hand. Delegate of United Kingdom as speaker 5. Delegate of Philippines as speaker 6. Delegate of Russian Federation as speaker 7. Delegate of Sweden as speaker 8, followed by delegate of Nepal. So delegate of Korea, you may have the floor for 60 seconds.
Yes. Hello all. To reduce the emergence of antimicrobial resistance in food chain, measures are to be taken at the offspring of the chain. So the WHO also states that inappropriate food handling encourages the spread of AMR. And education in safe food handling is a key measure for prevention of foodborne diseases, which probably includes and which mostly includes AMR. The Republic of Korea, through the Ministry of Food and Drug Safety, has also set a Codex Task Force on antimicrobial resistance, which enforces the law on food health as well. Thank you.
Thank you, Delegate. Delegate of Fiji.
Hello everyone. Antibiotics are used in food animals not only for treatment but also for disease prevention and growth promotion. WHO and other international bodies have recognized that antimicrobial use in animals contributes to resistance problem in human health. So preventing and controlling antibiotic resistance is a complex issue which involves many different sectors in which food safety is also a main. Regarding Fiji, understanding that chemical-based pesticides have been used extensively in crop production since the 18th and 19th century, the Council embarked on an awareness campaign since then. And the Pesticide Act 1971 was in which the registration and sales of pesticides is compulsory. The Food and Safety Act 2003 also promotes public health and safety with regard to the food and regulates the safety of the food. In which found any anomalies, then you are to contact the council on toll-free number 155 or email complaints@consumerfiji.org. Thank you.
Thank you, Delegate. Please refrain from using the personal website in your general speaker list. Delegate of Nigeria, you may have the floor for a minute.
Food plays an important role in the development and spread of antimicrobial resistance. As drug misuse extends to the agriculture sector, with the antimicrobials are frequently used for production and medicated feeds are administered in livestock production without professional advice, the consumption of animal products with high residue of antimicrobial is one of the contributors of antimicrobial resistance. It is of great public concern because the antibiotic resistant bacteria associated with animals pathogenic to humans, and it is easily transmitted to humans via food chains and widely disseminated in the environment via animal foods. So tackling AMR from food safety measure will really be helpful in preventing the development and spread of antibiotics. Thank you.
So thank you, Delegate of Nigeria. Yes, Delegate of Vietnam and Delegate of United Kingdom, you were raising your hand.
Point of personal privilege. The delegate of Federal Republic of Nigeria was not clearly audible.
Thank you, Delegate. I admire your point that has been raised. Delegate of Nigeria, please refrain from using a audible source while delivering the speech. For now, we have Delegate of Thailand. You may have the floor for 60 seconds.
Thank you. Food safety has a major concern in the development of the AMR as well as the controlling of the AMR also. It's been a primary source for the infection for transferring from plants, from foods to the humans, animals, and others. It's been a perfect source of AMR adapted microbes to get transferred into the humans and animals. In Thailand, according to the study, in AMR is also emerging an important concern in the food animal farming sector, as more than 50 to 100 antimicrobial products are registered with the Thai Food and Drug Administration, of which 2/3 are for humans and the remainders are for animals. This is showing that there are major Thai foods that which are being served, which are being the primary source for the infection and infection transferring. Thank you.
So delegate, please see the time frame that has been mentioned. If you feel like you cannot complete the speech, you may re-register your name, but you should not be speaking more than a minute. For now, we have United Kingdom. You may have the floor for 60 seconds sharp.
Food and feed for livestock can be contaminated with resistant bacteria on farm and from various sources. Better food safety and production can help limit the contamination of food stocks and spread of resistance. Achieving it requires strong risk management and solid understanding of how AMR travels through food chain. To help with this issue, UK plans to support collective surveillance effort for the food chain by working with the food industries, promote water sanitation and hygiene projects, and assess and track perception and understanding of consumers and the food handlers.
Thank you, Delegate. Delegate of Philippines. You may have the floor for a minute. 60 seconds.
With increasing population, world hunger rate is also increasing. That signifies more food, crop food producing animal production. Taking into consideration Philippines' aquatic and fishery sector, it is ranked among top fishery producing country in the world. The aquatic sector benefits from prudent use of antimicrobials in terms of improving biosecurity, treating chronic diseases. So proper collaboration among aquaculture and other food production country is crucial in breaking the chain of disease or infection transmission from aquatic lives, animal, human, and vice versa. Also, best practice, good aquaculture, food security mandates, and disease management should be taken into priority action to address AMR. Thereby, Food Act of 2013, Philippines mandated food safety regulatory agencies to be responsible for health of animals from where food is derived and effects of feed and other production inputs on otherwise healthy animals. Thank you.
Thank you, Delegate. I hope the Delegate of Nepal is preparing the working paper for this particular moderate caucus. For now, we have Delegate of Russian Federation. You may have the floor for 60 seconds.
Ingestion of AMR organisms via food result in human illness, and those illness might not respond to the available antibiotic and other treatment. A growing world population and which result in increase in food demand is putting added pressure on the food supply chain and its system. Russia is backing an FAO lead effort to promote food safety and to prevent the spread of medicine-resistant superbug in the food and on the farms of 5 countries in the Central Asia and the Eastern Europe with donation of nearly $3.3 million, which include strengthening the regulatory and legal framework, building national surveillance system to test AMR in food, raising awareness among the farms, animals, and human health professional and food safety authorities. Thank you.
Thank you, Delegate. Delegate of Sweden, you may have the floor for 60 seconds.
Thank you so much, Co-Chair. Fellow delegates, bacteria are all around us. It just takes them 30 minutes to multiply. When antibiotics are exposed, susceptible bacteria dies, but the resistant ones survives and multiply by transferring a part of their DNA to other bacteria. Antibiotics are given as a growth promoters to animals, and even if we do not take them directly, we do ingest the resistant bacteria. So in the food chain, antibiotic resistant is a threat not just to a human health, but also to animal health, welfare, to food safety, trade, and economic development. That's why food safety should always be on the top, and use of antibiotic in animals should be minimized to tackle this. Thank you so much.
Thank you very much, Delegate. So we have the last speaker for this motion of Moderator Caucus on topic food safety, that is Delegate of Nepal. You may have the floor for 60 seconds.
Thank you, ma'am. The delegate of Nepal would like to state that food is the major component that will help to promote the health, and if the food is itself infected or it is not good quality for the for taken, then human health and animal health will be degraded, since antibiotic are used as growth promoter in animals and to control the disease in animals, it is directly taken by human as animal source of food, and that cause very harm in human life. Antibiotic resistance develop food materials of animals intake will cause a great problem in human health, and thank you.
Thank you very much, Delegate. For now, the total time frame has ended for this particular motion. Do we have any other motion on the floor, Delegate?
Excuse me, co-chair.
Yes, Delegate.
Moderator has a question for the delegate of Russian Federation.
Okay, Delegate.
Are you prepared
Okay,
for the question?
so
Russia is one of the largest producers of poultry, and obviously the risk of resistance is very high in Russia, right? So, what are the laws and campaigns the Russian government has in place to combat antimicrobial resistance?
As delegate of Russia has already said, Russia is backing the FAO-led effort to promote food safety with $3.3 million, and which will promote the food safety and other guidelines which are necessary to food safety in Russia, and it's also provide awareness in the farmers and other food related industries.
I'm sorry for the delay. So right now, I would suggest you guys take an unmoderated caucus of about 20 or 30 minutes and then draft a working paper, which would technically cover everything that has been discussed today, so that it will be easier for you tomorrow or day after tomorrow to draft the resolution, right? So far we've had around 4 or 5 moderated caucuses. Can anyone update me?
So, Chair, we discussed a motion that was proposed by Delegate of Nepal on food safety regarding AMR for total time of 10 minutes, where 9 of the speakers spoke on this topic, followed by Delegate of Nepal who proposed the motion. And since the motion has ended, now we are expecting some more motion from the delegates. Over to you, Chair.
Okay, so far in today's from 2 p.m. till now, how many moderated caucuses have been raised? Like there was 2 moderated caucus in the beginning. Afterwards, we had 3. Now, I guess it's any delegates who was keeping updated with the number of moderated caucuses we had.
So, delegates, the chair is talking about the working paper that you were supposed to prepare on the basis of the proposed motion.
Yes, so who is working on the working paper right now? Any delegate who is taking the lead? You can unmute yourself and then straight away answer.
Yeah, we had 3 moderated caucus today.
Okay, so that's great. So have you guys decided to work and write the working paper so far? Anyone has taken any leads?
Delegate of South Africa would like to raise the motion to move into unmoderated caucus for the same.
Okay, so okay, yeah, you will move into a moderate caucus. Yes, delegate of Nigeria.
The delegate of Federal Republic of Nigeria would like to raise a moderated caucus on the topic role of hygiene in antimicrobial resistance for a total time period of 20 minutes with individual speaking time being 60 seconds.
Okay, so you can write it in the chat box so that everyone can see it. Are there any other points or motions on the floor?
Hello. Hello, I am audible.
Yes, delegate, you are audible.
Kingdom of Thailand would like to raise a motion to move into a moderated caucus on topic national health policies and strategies to overcome antimicrobial resistance.
Thank you, delegate. So
Thank you.
basically, what happened is we are having a class of interest in the committee session because of the technical disturbance of the internet connection of our chair. I guess we have already had two motions that has been raised in the committee session, right, Director?
Yes, one by delegate of Nigeria and another by Thailand.
So one by delegate of Nigeria and other by Thailand. So what was the motion that has been raised by Nigeria has already been mentioned in the chat section, whereas the motion that has been raised by Thailand is yet to be mentioned. We can take one more motion, and I expect the delegate of Philippines to deliberate. Delegate of Philippines.
The delegate of Philippines would like to raise an unmoderated caucus on a topic international collaboration need in AMR, in tackling AMR for the total time frame of 10 minutes with individual time period of 60 seconds. Thank you.
So, delegate, in order to raise an unmoderated caucus, you don't have to mention the topic, and we don't even need the individual time frame. I hope you rephrase the motion again and deliver it to the committee session once more.
Okay, yes. Delegate of Philippines would like to raise an unmoderated caucus.
Motion for unmoderated caucus for total time period of 10 minutes, 20 minutes.
Hello.
So, delegate, do you want to conduct an unmoderated caucus for total 10 minutes?
Yeah, for total time frame of 10 minutes.
Okay, thank you, delegate. So, as the dice feel like there is a need of unmoderated caucus in the committee session, we'll first proceed towards voting towards the motion that has been raised by delegate of Delegate of Philippines, that is to have an unmoderated caucus for total time period of 10 minutes. Delegate voting for unmoderated caucus in the committee, please tick mark as yes. Delegate of Nigeria, please be quick. Delegate of Thailand, delegate of Russian Federation, please let us know the voting stance. Delegate of Indonesia, delegate of Russia, delegate of Philippines, don't you want to vote for the motion that you raised? Okay. So we have 11 voting for the motion and 3 against the motion. This motion clearly passes. So for now, we'll be having an unmoderated caucus for 10 minutes in which the delegates are free to discuss about what is going to happen next in the committee session. You may have the floor. This will end at sharp 5:40 p.m. Delegate of Philippines, you may take over. Delegate of Philippines, please don't maintain pin drop silence when you ask for an unmoderated caucus. So any of you can take the lead. You may discuss about working paper. If you are in need of a format, then you may consult me or any of the DICE member.
Delegate of Philippines, can you please once more say the topic name?
So this is an unmoderated caucus. You don't need to mention the delegate. You can simply communicate. If you feel like English language is the barrier, then we have nothing to do with it, but please communicate. So delegates, please speak.
Chair, like question.
Yes, delegate.
So, for working paper, like individually prepare गर्ने होइन नि होइन लाइक यु निड अ टिम
अब यस्तो हो वर्किङ पेपर तपाईँहरूलाई चाहिँ मैले हिजो भनेअनुसार चाहिँ जसले मोसन रेज गर्यो उसले त्यो प्रिपेयर गर्दै गएको भए अहिले सजिलो भइसक्थ्यो तर आई डोन्ट थिङ्क यु पिपल हेभ डन नेपाल डेलिगेट अफ नेपाल तपाईँले फुड सेफ्टीको वर्किङ पेपर बनाउनु भएको छ त
नो
नो डेलिगेट अफ स्विडेन इकोनोमिक इम्प्लिकेसन अफ एएमआर को वर्किङ पेपर बनाउनु भएको छ
अलिअलि नोट त गरेको थिएँ पोइन्ट्सहरू तर त्यस्तो राम्ररी चाहिँ छैन
ओके सो अब अहिले अनमोड चलिरहेको छ 10 मिनटमा बी क्विक र यो जुन 3टादेखि 4टावटा मोसन्स हामीले डिस्कस गर्यो 3टा डिस्कस गर्यो त्यसमा चाहिँ तपाईँहरूले कसले के डिस्कस गर्यो भनेर प्रिपेयर गर्नुहोस् सो तपाईँहरूलाई फर्मेट चाहिएको हो भने आई क्यान स्क्रिन सेयर एन्ड सो इट टु यु पिपल आर यु इन निड अफ फर्मेट
Yes.
Yes, Chair.
Okay, delegate. Okay. So till the time I come with a working paper format, you may continue the discussion. So I don't expect pin drop silence, delegate. Please communicate. If you are in confusion, you may contact director, moderator, any one of us. Plus, please don't maintain silence.
Hi everyone. So basically, we need to come up with the solution to tackle this problem, and that could be only done by discussion. So, if anybody can take over.
Yes, you can start. We can help.
Okay, if we talk about food safety, like धेरै agriculture countries हरूमा चाहिँ 70% सम्म पनि एन्टिबायोटिक्स धेरै युज भइरहेछ ह्युमनको कम्पेरिजनमा सो त्यसको लागि सबै गर्नलाई रेजोल्युसन बनाउनु पर्यो and over the counter sales is like prevalent in every country in the world if like यसलाई नै स्टप गर्न सक्यो भने एकदम रिड्युस हुन्छ रेजिस्टेन्स
युकेमा चाहिँ लाइक त्यो ओभर द काउन्टर ड्रगको सेल्स कम गर्नलाई टार्गेट टुल किट भन्ने बनाएको रहेछ त्यसको फुल फर्म चाहिँ ट्रिट एन्टिबायोटिक्स रेस्पोन्सिबली गाइडेन्स एजुकेसन एन्ड टुल्स यो चाहिँ प्राइमेरी केयर हेल्थ केयर वर्कर्सहरूलाई अनि पेसेन्टहरूको लागि लिफलेट अनि त्यो वेटिङ रुममा राखेर लाइक अवेर गराउने रहेछ नाइस
तर युकेमा पनि अनलाइन सेल्स धेरै हुने भयो भएर अझै पनि छ होला
like 1 in 3 people are on the course of antibiotics.
सो हामीले वर्किङ पेपर चाहिँ एक्ज्याक्टली बनाएको रहेनछौँ होइन अनि अहिलेसम्म 3टा मोडरेटेड ककस भएको छ अनि त्यसको चाहिँ अब ब्रिफली हामी डिस्कस गरौँ न के छ अहिलेसम्म 3टा एउटा चाहिँ
वर्किङ पेपर बनाउन त्यो स्पोन्सर्स एन्ड सिग्नेटरिजहरू चाहिन्छ लाइक एलाइजहरूसित टिम फर्म गरेर बनाउने होइन
Delegate, is my screen visible?
Yes.
So this is the sample of an international model United Nation. Your working paper does not need to be as complicated as this is. Since a lot of you are beginners, we don't expect that much of courtesy from you people, but at least meet the basic things. See, this does not follow any specific format. The only thing that has been mentioned is the signatories, the one who have been following this working paper. There has been no sponsor. That means individual अथवा 3-4 मान्छेले मात्र लेखेको होइन यो यसमा जसले बोल्यो त्यसको मान्छेहरूको नाम त्यो कन्ट्रीहरूको नाम लेखेर चाहिँ उनीहरूको के स्टेटमेन्ट छ भनेर मेन्सन गरिएको छ र यो मेन्सन गरिएकोलाई नै पछि हामीले रेजुलेसनमा इन्क्लुड गरेको थियौँ EIMU 2019 मा चाहिँ हामीले यसरी कसले के भन्यो भनेर इन्डिभिजुअली लेख्नु भन्दा पनि यो कन्ट्रिजहरूले चाहिँ यो मोसनमा बोलेको थियो भनेर यो प्रिपेयर गर्यो त्यसपछि यो कुराहरू भनेको थियो भनेर सर्टली मेन्सन गर्यौँ किनभने सबै डिटेलमा रिपोर्ट बनाउन जस्तो गर्नु पर्दैन सिम्पली दिस आर द इम्पोर्टेन्ट थिङ्स भनेर टक्क मेन्सन गरेर यसरी एउटा स्टेटमेन्ट बनाउँदाखेरि चाहिँ पछि रेजुलेसनमा डिरेक्टली एड गर्न पनि सकिन्छ सो यसरी चाहिँ वर्किङ पेपर बन्छ सिम्पली नोट डाउन गरेको हो नथिङ कम्प्लिकेटेड
हामीले त्यो भन्नाले ड्राइभमा एउटा फोल्डर बनाएर अनि लिङ्क सेयर गरेर एडिट गर्दै बनाउँदा नि भयो नि
यस डेफिनेटली अब भर्चुअल नभएर रियल एम्युन भएको भए रियल भन्दा नि फिजिकल एम्युन भएको भए भने चाहिँ तपाईँहरू एउटा ठाउँमा जम्मा भएर गर्न मिल्थ्यो अब यो भर्चुअल भयो सो अब तपाईँहरूलाई चाहिन्छ नै भने चाहिँ ओसीलाई रिक्वेस्ट गरेर यसपछि पनि मिटिङ एड नगरिदिकन तपाईँहरूले डिस्कसन गर्न पनि पाउनुहुन्छ कुनै जुम लिङ्कबाट अथवा ह्याङआउटबाट डिस्कसन गरे पनि भयो or else Google Doc-मा बनाएर written format-मा discussion गरेर यसरी formalize गरे पनि भयो.
I would like to add one more thing, like all the delegates after this session can communicate via Viber group and make a Google Doc and edit and jot down their ideas or solutions which they propose to certain moderated caucus or another topic. So that would be better, I think, preparation of Google Doc and editing by all the delegates.
So okay, so तपाईहरुले Google Doc बनाएर एडिट गरेर त्यसरी नै सर्कुलेट गरे पनि भयो तर यसरी I see no communication between you people है अहिलेसम्ममा चाहिँ अब नेपालले मोसन प्रपोज गर्यो उलाई नै उसको मोसनमा कसले बोल्यो थाहा छैन This is not how a committee works. अरु कुनै queries?
Yeah, after this session, one of you can save the screen who can take the lead in making working paper and everyone can communicate and jot down ideas.
Exactly. So, तपाईहरुले अब working paper clear भयो भए shall I stop sharing my screen?
Chair, I have a question. Like यो सबै कन्ट्रीजहरु त इन्क्लुडेड थिएन हैन त्यसमा अनि हामीले
जो बोलेको त्यो मात्र इन्क्लुडेड थियो अब यहाँ डेलिगेट अफ अल्बानिया डेलिगेट अफ जापानले के बोलेकै छैन उसको नाम के लेख्ने त
एभ्री मोडरेटेड ककसको टपिक चाहिँ डिफरेन्ट बनाउने त्यो चाहिँ लाइक जसले
सो अब अहिले चाहिँ त्यो पोसिबल हुँदैन जस्तो लाग्यो मलाई किनभने आज 3-4 डिस्कसन भइसक्यो 3-4 पेपर बनाएर भ्याइदैन भोलिदेखि चाहिँ तपाईहरुले जसले मोसन उठाउनु भयो त्यसले बनाउन थाले पनि हुन्छ अथवा उसको ग्रुपले बनाउन थाले पनि हुन्छ आजको लागि चाहिँ बाइ टुनाइट सबैजना जम्मा भएर एकैचोटी यो मोसनमा चाहिँ यो कुरा इन्क्लुड भएको छ है भनेर मेन्सन गरिदिनुस् न सो दैट पर्सिसम्म बनाउँदाखेरि चाहिँ नबिर्सियोस् कुनै इम्पोर्टेन्ट पोइन्ट्स जस्तै अब तपाईहरुले लेख्दाखेरि चाहिँ के लेख्नु भने टपिकमा इकोनोमिक इम्प्लिकेसन अफ AMR लेख्नुभयो भने चाहिँ त्यो टपिकमा के इम्पोर्टेन्ट कुरा भनेको थियो त सबै लेख्नु पर्दैन लाइक स्विडेनले कुनै स्टेटमेन्ट बनेको छ भने त्यो स्टेटमेन्ट मेन्सन गरिदिनुस् त्यसपछि फलोड बाइ फुड सेफ्टीको कुरामा फिलिपिन्सले एउटा एक्टको कुरा गरेको थियो त्यो एक्ट लिबरलाइजेसन गर्ने कुरा गरेको थियो त्यो एउटा इम्पोर्टेन्ट स्टेटमेन्ट भयो त्यो मेन्सन गरिदिनुस् त्यो समरीमा चाहिँ सबैको प्रेजेन्समा चाहिँ मैले भनेको कुरा चाहिँ मेन्सन गर्यो भने पछि सजिलो हुन्छ जस्तो लाग्नेले त्यो Google Doc मा एड गर्दै जादा पनि that will be very convenient while forming a resolution. Is that clear? So अब 1-2 जनाले लिड लिनु पर्यो है यसमा चाहिँ अब हामी ओसी डाइजले यसो प्लेटफर्म दिदैनौं one of you take the lead make a Google Doc स्टार्ट राइटिङ। यसरी नै रेजोल्युसनमा स्पोन्सर्स बन्ने हो तपाईँहरू। कसैलाई वेट गरेर हुँदैन, यसमा चाहिँ आफै लिड लिनुपर्छ।
Google Doc form गरिदिन्छ है त, like for 3 moderated caucuses.
सो 3-in-1 गर्दा पनि हुन्छ। अब आज चाहिँ इन्डिभिजुअली गरेर राख्नु परेन, भोलिदेखि चाहिँ इफ पोसिबल त्यो कम्युनिटी सेसन हुँदाहुँदै जट डाउन गर्न थाले पनि हुन्छ। र अब हाम्रो अनमोडको टाइम त सकिसक्यो। अरू कुनै क्वेरिज अनमोडमा के चाहिँ गर्ने जस्तो लागेको छ भने क्वेसन सोध्नुहोस्, किनभने आज चाहिँ इट्स अल अबाउट फेसिलिटेसन प्रोग्राम।
I have a question.
Yes, delegate.
अघि नै मेरो नेटवर्क अनस्टेबल भएको थियो, के भयो अनमोडरेटेड ककसको अलिकति भनिदिनुहोस् न।
ओके, सो अब मैले अनमोडमा चाहिँ मैले के भने चाहिँ वर्किङ पेपरको बारेमा सोधेँ। हिजो मैले तपाईँहरूलाई वर्किङ पेपरको फर्मेट हुँदैन भनेको थिएँ, तर पनि नट अफ यु स्टार्टेड द वर्किङ पेपर। जट डाउन गर्नुभएको छ अरे डेलिगेट अफ स्विडेनले। अब त्यो जट डाउन गरेको पोइन्टहरूलाई चाहिँ युनाइटेड किङडमको डेलिगेटले एउटा गुगल डक बनाएर शी विल फेसिलिटेट यु पिपल विथ अ गुगल डक। त्यसमा चाहिँ तपाईँहरूले आज डिस्कस भएको मोसन्सहरूको चाहिँ इम्पोर्टेन्ट पोइन्ट जट डाउन गरेर वर्किङ पेपर बनाउनुहोस्, सो द्याट पछि रेजोल्युसन बनाउँदाखेरि चाहिँ इम्पोर्टेन्ट स्टेटमेन्ट चाहिँ मिस आउट नहोस्। र मैले एउटा वर्किङ पेपर डिस्प्ले पनि गरेको थिएँ। बोल्दै नबोलेको मान्छेलाई इन्क्लुड गर्नु पर्दैन, तर बोलेको मान्छेको कुरा इम्पोर्टेन्ट छ भने चाहिँ त्यसलाई चाहिँ इग्नोर गर्नु भएन। द्याट इज अल वाट आई सेड। एनी अदर क्वेसन्स? अब आफै कम्युनिकेट गर्नुहोस् ल। आई फिल लाइक अनमोडलाई चाहिँ अलिकति एक्सटेन्ड गर्नुपर्छ जस्तो लाग्यो मलाई। सो 540 को सट्टा 550मा एन्ड गरौँ इफ इट्स फाइन विथ द डिरेक्टर एन्ड द मोडरेटर।
यस्तो भयो नि त। अनि फर्स्ट बिर्स्यो क्या, अनि त्यही भएर थाहा नभएर नोटै गरिएन।
हो, त्यही त बिर्सनु भएन कि, किनभने आफैले रेज गरेको छ अनि आफैलाई चाहिँ कसले चाहिँ प्रब्लमलाई सल्युसन सजेस्ट गरे थाहा भएन भने त व्हाट क्यान वी एक्सपेक्ट इन अपकमिङ सेसन्स। सो अब आफूमा कम्युनिकेट गर्नुहोस् र ग्रुप च्याटमा इफ यु फिल लाइक भोलि म यो मोसन उठाउँदैछु भने चाहिँ मोसन लेखिदिनुहोस् कि, सो द्याट भोट गर्दाखेरि चाहिँ डिसएग्रिमेन्ट भन्दा पनि एग्रिमेन्ट धेरै आओस्।
मैले त एम्टी लाइक गुगल डकको फाइल राखेर लिङ्क पठाइदिएको छु।
च्याटमा लिङ्क आइसकेको छ, सो प्लिज गो थ्रु द लिङ्क।
यो लिङ्क चाहिँ भाइबरमा पनि सेयर गर्दाखेरि राम्रो हुन्छ होला नि है?
डेफिनेटली, भेरी गुड पोइन्ट। सो अब चाहिँ shall we move into the formal committee session अनि end आजको मिटिङ, किनभने we just have 50 minutes remaining। केही क्वेसन छ भने चाहिँ मिटिङ एन्ड गरेर चाहिँ क्वेसन एड्रेस गर्ने हो कि अहिले सबै क्वेसन एड्रेस गरेर चाहिँ सकाउने हो त? मैले यहाँ मोबाइल भाइब्रेसन चाहिँ सुनिरहेको छु, बट आई डोन्ट हियर एनी अफ यु स्पिकिङ। के हो यस्तो? किन यस्तो अकवर्ड साइलेन्स गएको त? यसरी गिट अफ यु के अनमोड हो, तपाईँले ह्यान्ड रेज गर्नु पर्दैन, यस्तो चाहिँ बोल्दा हुन्छ।
पोइन्ट अफ इन्टरटेनमेन्ट रेज गर्न लाग्यो।
ए ओके, द्याट्स एक्सट्रिमली एप्रिसिएबल। अब तपाईँहरूलाई इन्टरटेनमेन्ट चाहियो भने विल डु द्याट। सो अब चाहिँ अनमोड एन्ड गरेर फर्मल सेसनमा इन्टर गरौँ। त्यसपछि आई विल बी आस्किङ फर मोसनमा तपाईँहरूले इन्टरटेनमेन्ट प्रपोज गर्नुभयो र भोट आयो भने वी क्यान ह्याभ 10 minutes इन्टरटेनमेन्ट सेसन। Shall we, Director?
Yes, sure, co-chair. We have 4 minutes left to end the on-mode session. Shall we just end within 4 minutes or just enter to the formal
session? I think it's better if we enter to the formal session now.
Okay, sure.
So the motion is now in order. Delegates, we hope
you had a very productive time in this unmoderated caucus. So I want a summary of what happened in this unmoderated caucus from one of the delegates. Anyone volunteering to summarize me what happened during the unmod session?
Okay, I will like to summarize
Okay.
today's unmoderated caucus chair.
Unmoderated caucus.
Unmoderated caucus chair. Today, basically, we learned quite more about the working papers, है ना? अनि सबै जो जसले मोसन क्रिएट रेज
Please
गर्नुहुन्छ
speak in
उहाँहरूले
English, delegate. Please speak in English. We are in the formal session now. Don't use personal pronoun.
Okay. Okay, sorry, Chair. Okay, I would like to proceed now. Today we discussed on the process of writing the working paper in the unmoderated caucus, along with the particular particular delegate raising the motion should have prepared their working paper separately. We understood the fact. Moreover, not only that, we got a bit more knowledge on the going on situations and the agendas that we set today in different countries, and we are proceeding from tomorrow onwards to completely have a detailed working papers. That is
Thank
all
you,
I want
delegate.
to say.
Okay, so delegate, it is not the fact that the person has to make a working paper. That may be a group of people as well, but that has to be prepared. Whether that might be an individual or a team. That might be a team of Asian countries, that might be a team of South Asian countries, that might be a team of European countries. We have nothing to do with it, but that has to be prepared. So for now, delegates, do we have any motions on the floor? Delegates, do we have any motion on the floor? Please raise your hand. Delegates, are there any motions on the floor? Yes, delegate of United Kingdom.
The delegate of United Kingdom would like to raise a point of entertainment.
Motion of entertainment, delegate.
Sorry, motion of entertainment.
For the total time period of 10 minutes?
Yeah, 10 minutes.
Okay, thank you, delegate. Are there any other motions on the floor? Yes, delegate of South Africa, followed by delegate of Russian Federation.
Point of parliamentary inquiry.
Yes, delegate.
Can all the delegates prepare a single working paper?
Yes, delegate, definitely. So if you feel like one working paper could sum up the all mentioned stuffs in the communication, definitely you can work for a single working paper. Delegate of Russian Federation.
Delegate of Russian Federation would like to second the motion raised by United Kingdom.
Thank you, delegate. So for now, we will be voting for the motion that has been raised by delegate of United Kingdom to have a motion of entertainment for 10 minutes. So delegate voting for the motion, please tick mark as yes. And if you vote against the motion, please tick mark as no. Yes, delegate of Russian Federation. So
It
delegate
was by
voting
mistake.
for, okay, thank you, delegate. Delegate voting for motion of entertainment, please tick mark as yes. Voting against the motion, please tick mark as no.
Delegate of Thailand, delegate of Russian Federation, please make your stand on this motion.
Delegates of Korea and Nigeria.
With 12 yes and 0 no, this motion clearly passes. Now, delegate of UK, you have raised the motion. So, would you like to speak at the beginning or entertain at the beginning or at the last?
So, in addition to the statement that has been made by director, by default, the delegate of United Speaker will be the first one. So, delegate, you may have the floor for.
The delegate of United Kingdom was unaware of the fact.
So, since now you are known about this, we expect you to sing a very beautiful song in order to refresh all the committee members. Why not to expect the director to sing a song to the committee? After all, entertainment has to be initiated from the dais member. So maybe have
Yes,
director singing a song.
exactly. The point of entertainment is supposed to be entertained by the DICE members.
So
The
director
director
could
believes
do us
that
a favor by singing a
point of
song.
entertainment was raised by delegate of UK. So delegate of UK has to entertain first in the committee, then only other members will entertain. So delegate of UK, over to
Okay,
you.
UK, please take an initiative so that our director could sing a beautiful song to all of us. Please. Please don't waste the time, delegate. Delegate of UK, let's have some virtual clapping for the delegate.
What song would the committee like me to sing?
So we even
The
allow
delegate
Nepali
of
song
UK
entertainment
is
session.
very bad at singing.
Never mind, delegate, we'll not see your face again. So please, don't hesitate.
Yeah.
Delegate of United Kingdom, please don't feel shy or awkward. Please sing a song. We all are awaiting to listen to your soothing voice. See, there have been all people clapping for you, and there has been awkward silence at the same time.
Are there any recommendations for the song?
It's up to you. You can sing your favorite one, delegate. So there has been a very beautiful song that has been sung by delegate of Definitely, we can start, choose a song and start singing. Or else we have to suspend the meeting because we are at the end of the session. Any one of you take a sleep break for 5 minutes or 10 minutes so that we can suspend the meeting. So, okay, delegate of United Kingdom, please start singing any one of the songs so that all of us can join.
Um, okay, so this is a Nepal's favorite song, yeah, evergreen song. Um, I'd like other delegates to join me. Resam Siri, Resam Siri, उडेर जाऊ केटा भन्छन् रेशम Siri.
एक नाले बन्दुक दुई
मैले मायालाई डाकेको
रेशम फेरि उडेर जाउँ कि डाँडैमा भन्छन् रेशम फेरि
Wow.
So cute.
Delegates? This has been very awkward silence, delegate.
Yes, coach. Yes, co-chair.
Can we ask other delegates to perform something?
It's already 6 p.m.
So, this awkward silence was really demotivating. That is why we have to move towards adjourning the meeting for the session today. So, Director, could you please ask for the motion and adjourn the meeting?
Do I need to ask like the director would like to raise the motion to adjourn the meeting?
No, delegate. So, Director, what you have to do is you have to ask, are there any motions on the floor?
Yes, sir, co-chair. So delegates,
Yeah,
are there any motion on the floor? Yes, delegate of United Kingdom.
The delegate of United Kingdom would like to raise the motion to adjourn the session for today.
Thank you, delegate of United Kingdom. Sizulu Rizal. Okay.
Delegate of Nigeria.
Yeah. Delegate of Nigeria, do you have any motion? Delegates, are there any motions on the floor? Yes, delegate of Republic of Fiji.
Delegate of Republic of Fiji would like to raise a motion if this MUN could be started from 10 a.m. to 2 p.m. If
Thank you, delegate of Fiji. Delegates, are there any other motions on the floor? Delegate of South Africa.
Delegate of South Africa would like to succumb with the motion of United Kingdom.
Thank you, Delegate of South Africa. So now let's go to the motion raised by Delegate of Fiji at first. If we could continue the tomorrow session by 10 a.m. So the delegates who are in the favor of the motion, just tick yes button, and who are not in favor of the motion, tick the no button. Delegate of Russian Federation. Okay. We have 8 yes and 5 no, so the motion clearly passes. So, co-chair, we will have session tomorrow at 10 a.m. Okay, delegates, are there any other motions on the floor? Delegates, are there any other motion on the floor? You are supposed to raise the motion to adjourn the meeting now. Okay, Delegate of Russian Federation.
Delegate of Russian Federation would like to know if it is feasible to end today's session by now.
Thank you, Delegate of Russian Federation. Delegate of Russian Federation has proposed to adjourn the meeting. Yes, Delegate of Sweden.
Can we get the recording of today's session so we can actually work on the working papers?
Yes, definitely, Delegate of Sweden. You will get the recording tonight.
Yeah,
So,
and then I think we can actually work on the moderated caucus working paper, and then it would be quite easier for tomorrow.
is your Delegate of Sweden. Are there any other motions on the floor? Seeing no other motion, so delegates who are in the favor of the motion raised by Russian Federation, please tick yes, and who are against the motion, please tick no. Delegate of United States of America. Okay, we have 11 yes and 0 no, so the motion of the delegate of Russian Federation clearly passes. So the organizing team wishes you all the best for tomorrow. We will meet at 10 a.m. sharp, and delegates can join with the same link which is provided to you. So the meeting is adjourned for today. Thank you, everyone.